All right, I wait for that to now I know we're officially starting. At this time, I want to welcome everyone to the mid-year point. It's always an exciting time of the year, a little warm, but it's good. We are sitting here in the historical grounds of the Confederate Tribes of the Colville Reservation, and all of us do walk the same steps that our ancestors have walked time immemorial. So I wanted to acknowledge that. And next month is our tribal election, tribal seating of new tribal board chair, and the different committees will be created at that time. And it's an exciting time. We have our 4th of July celebration in Nespelum. Has been going on for hundreds of years now. We're all meeting here today again on Zoom. So the Zoom etiquette, we do ask that you keep your cameras open and let us see your faces. And if you have anything that you want to say, you can either raise your hand or you can also put it in the chat. I'll start with the board roll call at this time. I may skip over some who we know are absent already. So Carlene Anders.
Yes, I'm here. Thank
Yay,
you.
thank you. And Dell Anderson. Ken Sterner. Ray Eichmeyer.
Present.
Thank you. Linda McKay.
I'm here.
Thank you. Senator Warnick. Here.
I'm here.
Dr. Tuggy.
Here.
Maddie Osborne.
Good afternoon, here.
Thank you. Teresa Atkinson.
I'm here.
Thank you. Nancy Spurgeon.
Here.
Peter Morgan. Ken Sterner is here. Okay. Chatted that in. As you can see, we have our approval of the consent agenda and the attachments. I hope everyone had a chance to look through everything. And this is your time to let us know if you have any declaration of conflict of interest. But as the meeting goes along, if you do feel like it's stepping into squishy ground and you want to have us acknowledge your conflict, please let us know. Put it in the chat, put your hand up, whatever you need. Also, public comment. At this time, I'm not sure if we have any public comments. I do ask our partners, put your name and organization in the chat so that we can acknowledge that you're here. John, did you want to? Yes.
I'm sorry to interrupt.
That's okay.
I'm not sure where would be the appropriate time to let the board know. I'll leave it right here. But at some point over the next month or so, I will be leaving the board. And I will be pursuing some other things with aging and adult care. And so I wanted to give some appropriate notice to folks to let what's going on. John and I have had some conversations already.
Okay.
And I've also invited some folks from our aging and adult folks as well. And so you may be seeing some strange faces too, but I wanted to let everybody know. And that's it.
I'm sorry to hear that, but I understand exactly.
And Ken, just to clarify, there is no stranger face than you. Don't worry.
Thank you, John.
John, do you want to scroll through the consent agenda documents?
Yeah, I think I'll put a note. You're going to see a much bigger agenda here. So there's 3 things that are coming forward from the Finance Committee: the audit proposal from DZA, the prepaid policy, as well as the capitalization policy. So the Finance Committee has reviewed all of that and endorsed it for approval of the board. The one thing I'll say for the audit proposal is we had 2 proposals submitted to the Finance Committee, and DZA's was the one best fiscally in alignment with what we were thinking for costs, as well as they've worked with a number of partners, as well as auditing another ACH, and is currently auditing another ACH, so they just fit well for that recommendation. You guys have the full proposals if you guys have any questions, and the finance committee thought we could put that in the consent agenda.
Okay, so upon approval of the consent agenda, then that also carries forward for those 3 items.
Correct.
Correct, okay. Has everyone had adequate time to review? Please let me know if you need more time.
The other thing I would say is if you have questions, you're stuck with me. Rosalinda is off on vacation this week, as well as Sarah Krowski, our consultant CFO, is traveling this week as well. So they've gotten the opportunity to go have fun while we all get to meet.
Well, hearing no further questions, I ask for a motion to approve the consent agenda.
Nancy Spurgeon, I move we approve the consent agenda.
Thank you, Nancy.
And I'll second Judy Warnick.
One final call for questions. There's a lot on this. It's a good 40 pages of information. But hearing none, I will call for a vote. All those in favor say aye.
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 Opposed would be nay. And we do have a record of the absent votes, so motion carries. Thank you for the approval of the consent agenda. So now the next up is Executive Director's Report. John.
Perfect. And as I get started, 2 faces on the screen, I do just want to call out, and I'll give a little bit more of a bio when we get to that section, is Bruce Goldberg and Kathy Kaufman. I see Bruce and Kathy waving. So they are part of the Artemis consulting team, which are the consultants that the 9 accountable communities of health, now the coalition of ACHs as an association, use to help provide all of us direction. So when you think of all 9 ACH executive directors, CEOs, these 2, as well as their counterpart, Diana, are the ones that are helping guide all of our thought process through the state work. So any questions you have, feel free to ask them, and then they'll let you know all of what we're thinking across the state, or at least what they think we're thinking across the state. Otherwise, I think, Caroline, do you want to just bring up the screen? Other things I just want to note, thank you all for joining us. It is weird to think that it is June now. It does not feel like we are pretty much almost at the halfway mark of the year. And it's just impressive what we've gone through and done together this year, as well as scary to think that we are already going to be moving and thinking about 2024 here pretty soon. I want to give a shout out to Senator Warnick, because I know it was a long legislative session and a lot happened during that legislative session, including a special session. So
Yes. I'm just glad that it only went for 1 day instead of 30 for the special session. So thanks, John.
thank you for everything you all do up in Olympia. So I know it's a busy, sometimes enjoyable, maybe not enjoyable time some other times. So we appreciate all that work.
Well, thanks, John. Glad to do it.
And then thank you all. Again, I know we are hitting vacation season, so I know this time of year also becomes a little bit more harder to align schedules. If you go to the next slide. I pretty much gave the basics of the consent agenda for the finance committee, but again, just to emphasize, our committee has spent time evaluating the proposal and the policies. So if you ever have any questions, let myself know, let Rosalinda or any of the other committee members, which includes Peter and Teresa as well. Another note, I know it's not on here, but also we had our first, with the investment policy and with the investment firm that we're using, CLA Wealth Advisory, we had our first treasury note come due, and so we are going to be working at determining what we keep and what we reinvest with that work. We had other quick update, we had a great governance committee meeting this morning at 11 a.m., which includes Carlene, Linda, and Manuel. And so I wanted to thank them because I already asked for another hour of their time today on top of a 3-hour board meeting. And we had a chance to look at a draft summary of our board retreat in May, and we are looking at some recommendations around board composition change, how we would make some of those adjustments, including looking at how we identify who we identify as kind of the end user of the work we're doing as Thriving Together, how that would impact board composition, and then how we want to look at what structures and flexibilities we have in the board. We still looked at, again, the sector representation we have in our board and what we think is vital to keep and where we could find some flexibility with the concept of increasing and promoting diversity amongst our board members. We will have, the goal is to have a recommendation that we vet over the next month or two that we can then bring back for a final recommendation to the board. But let me ask Linda or Carlene, I gave just a really brief summary. Is there anything you guys would like to share with the board or comment on the meeting we had this morning?
I just think there's a lot of good perspectives, John. I think we're trying to narrow in on not being too particular, but getting a good representation all the way around the board. So lots of good discussion this morning.
Yeah, I agree.
Yeah, I think we're trying to find that, like, threading that versus having a structure that supports bringing in the key players we want to have on the board while not being so focused that we kind of basically create a structure where the people are already selected so that we have the ability to look at who would be great players on our board. Quick note on the board retreat recap. So those of you who were unable to make the board retreat, I am trying to schedule a few minutes with each of you just to give you guys a recap of the board retreat, some of the key highlights that were shared by board members that also got included into our governance committee discussion. We had just a few key highlights. We had our Valley, our future, Steve Maher, their director, come and present on the work that they're doing so we can see really what some of these local collective impact models are and how we can better intertwine and coordinate with them. Summer Hess came, who is focused on one of their game changers, many voices, one region, and diverse leadership. And that was really to learn and grow how we can continue to build diverse leadership in our own organization. And then the afternoon session, we had Liz Baxter from the North Sound ACH come and share their governance journey and how they have transformed or looked at their governance differently, as well as their board structure. And again, that led into a good conversation around what we are hoping and looking for our own board composition, even around how we're looking at our governance structure. And I thought it was a great meeting and a great conversation. Appreciate those board members who stayed afterwards for the social. Understand those who had to get back, because it was a Friday afternoon. And I know a few people had a drive to make as well. But we will be sending out, we're finalizing that retreat summary, and we'll be sending that out with any applicable presentation documents as well. And you'll see that this week. Next slide. A few operational updates. We have been going through the process of hiring our director of network development. We're in the final stages of an offer process. And so by the time we get to our next board meeting, you will see a new employee hired and on the screen. We're not quite at the stage yet where I'm able to share the name of the individual because they have their own internal processes they need to take care of on their side first before we release anything publicly. The chart program, I know I've shared an update around the chart model that the Healthcare Authority has been doing in our region for a while. As you guys all remember, the CMS and the Healthcare Authority decided to discontinue chart because they couldn't get enough hospital participation and discontinue the alternative payment model of that. CMS has told HCA that they are willing to continue and look at the community transformation plan of the chart model and fund portions of that through the end of September. So we are working with the healthcare authority to see what that could potentially look like. And there may be different initiatives and projects that may occur over the next few months to help fund some of that work. The best thing I can say is that, you know, in the spirit of sometimes how federal government works, is that they were pretty much giving us 3 months to look at this work and figure out how to fund some projects under it, which is not a lot of time. Means that you have to be a little precise on how we do our planning and what work we could support, and some of that may include some trainings that we offer in our region. So it's nice to see that CMS is interested and open to us doing some of that work under the chart model and the community transformation plan under the chart model, but it's still yet to be determined what we really can do. I know Dell's not here. I'll move down next. Dell is not here, but I want to just give a shout out to Renew for hosting our April partner convening. And it was great to see Dell's team there, as well as Luke from Only 7 Seconds. We had Alyssa from Hope Squad available, as well as the recovery coach from Okanagan Fire come and present. And so the focus was really on behavioral health, with a specific focus on youth behavioral health as well. And we will be able to, I believe we have that recorded, right, Mariah?
Yes, I just put the recording in the chat. There's a YouTube link.
So Mariah put the recording in the chat, so I encourage you to take a look and watch a portion of it to learn a little bit about what partner convening was covering and a little bit more about behavioral health services in our area. The other shout out I would give is we launched our Dare to Lead training in the region, and thank you to the team, Caroline, Mariah, Teresa, anyone else from the team who was involved with putting this together. I apologize who I'm leaving out. We had about 50 participants from across the region participating in the Dare to Lead training. And it's amazing to see the participants. We have what you would consider traditional leaders down to recovery coaches, down to emerging leaders. It's just a great opportunity to see how we can continue to support and build diverse leadership, including those who traditionally don't have the opportunity to build those skill sets, what we can do to support that kind of work in this region. So thanks to the team for putting it together. I have the opportunity to participate in it. I think I was nudged because the team felt like I could benefit from Dare to Lead as well, training. So they encouraged me to participate as well. And I just enjoy the training, and I think anyone would really benefit from it. Next slide. A few key partner updates, and I'm going to jump into a few pictures, but a few things I just want to announce that we don't have photos for to keep everyone up to speed on. A couple months back, we actually funded a housing study with Upper Valley Mend, where they hired a consultant to look at their ability to go seek funding and do a capital campaign to buy supportive housing up in the Leavenworth area. Caitlin Bittner from Upper Valley Met sent me the report, and the report showed a plan in place, and they do have a plan in place to actually seek about $6.8 million in funding across both philanthropy and state and federal and local funding to do sustainable housing up in Leavenworth. And it is amazing the work that they put together and the work they're progressing forward with. And the reason why I want to call that out is our portion in that work was minimal. So we basically supported $30,000 for their organization to do a feasibility study and hire a consultant to do a feasibility study for housing. But with that, they're going to be able to go out and work with the consultant moving forward to get millions of dollars in building sustainable housing in that area. So again, it's a unique way on how we can look at utilizing our funding to get over the humps to do things that support humane housing that then partners can utilize to move to seek greater funding and greater collaboration to do this work. Shout out to the NCW Tech Alliance, Community Health Network of Washington, and ourselves presented at the State Digital Equity Conference, which was here in Wenatchee, hosted by Goodwill across the state. And we had a chance to share what is going on with the digital equity work in North Central Washington, as well as the Digital Navigator grant that Community Health Network of Washington has. If you go to the next slide. If you had a chance to check out the Wenatchee World this weekend, and that happened after I put these slides together, so I don't have that article on here. There was a press release on the 2023 Hope Squad Conference. So as you guys all know, the Hope Squad has been a funding partnership between Cambia Health and ourselves as part of funding we received a couple years back, I want to say in 2020 or 2021, to look at suicide prevention across the youth in schools. And so we, again, are one of the largest implementations in the nation for Hope Squad. And you can see on this photo, this was the first year they've been able to do an annual conference where they had 200 plus participants, both advisors and students, come join the Hope Squad conference. You go to the next slide. You can see a few pictures of the conference that occurred. And so we had, the opportunity to hear from Dr. Greg Hudnall, who is the Hope Squad founder, who was able to fly in from Utah and share the work of Hope Squad overall. We had Dr. Julie Rickard come and share her story as a psychologist. We had Haley Croce share a little bit of the work that Together for Youth is doing around marijuana prevention and youth prevention work, as well as opportunities for youth to come together and share really what they're doing in their schools around suicide prevention. You go to the next slide. Again, this is across the 4 counties. So we had school districts in every county come and attend this. Go on to the next slide. What I can say is it was a great event. It was a partnership of Together for Youth and ourselves. I really do want to give a shout out to Teresa, Mariah, and Morgan, who from our team helped support hosting the event. And, there's nothing better to see youth come together and present and show excitement on this work. These are the individuals who, when we get older, are going to be leading this work and going to be driving this change in the future. And so the more and more we can get upstream and engage those individuals, the more likely we can make this work sustainable. Next slide. The other thing I just want to shout out for is as part of our cross-sector funding, Caroline, Mariah, you're correct, it was under cross-sector.
Correct.
Yep. We funded Chelan Douglas Community Action Council in support of them helping build a food distribution or acquiring a building for a food distribution center. So you're going to see a few pictures on here. And right now you can see, in the top left, their current fridge, current freezer space. And then the bottom 2 pictures, they acquired the CNO nursery building on Wenatchee Avenue. And so you can see the new space that they're going to have. And so you can see just significantly the size of space and access they're going to have for food storage, for support in being the distribution center. Caroline put into chat, our funds support their future commercial kitchen so that they can focus on allowing individuals to process food for sale or even doing classes as well. So again, this is an example of, our portion of funding may have been a small drop in the overall funds they needed to acquire the space, but ultimately they're going to be able to do amazing things with this. And we were able to fund one portion of it that it was harder or more challenging for them to find access to funds to. And so again, it is just great to see their ability to go and expand these services, which will really expand access to healthy food across our 4 counties. And with that, next slide, I believe that is all I have. Any questions? I think there is none. So Molly, would you like to move to the next part?
Yes. So the next on the agenda is the MTP Waiver 2.0 and care coordination updates And we have Bruce Goldberg and Kathy Kaufman from Artemis Consulting.
And Kathy and Bruce, I have your slides and I can run them if you just tell me next slide, or you can do it yourselves. What do you prefer?
You want to run them, Carolyn? That would be great
Yep, sounds good.
for that.
So if I can do a quick intro, and Bruce did, Kathy, I told Bruce I could not find a bio from him online, and so he sent me one in chat, which is now very, very small. So I'm gonna try to introduce Bruce first while I read this. So Bruce Goldberg, MD, is a professor at OHSU, PSU, School of Public Health, and a nationally recognized health policy expert. He served 2 Oregon governors as the director of the Oregon Office for Health Policy and Research, director of the Oregon Department of Human Services, and then was the founding director of the Oregon Health Authority. He experiences span times as an administrator of large complex organizations, practicing clinician, teacher, academician, a county health officer, medical director for the Medicaid Managed Care Organization, clinical director for the U.S. Public Health Services in Zuni, New Mexico. So that is Bruce Goldberg. Kathy Kaufman, who has
You know, he's mostly as good as he sounds, John.
yeah. So
I
he's
wish.
nothing, but he really does have something put together. Kathy has been a leader in transforming the delivery of healthcare and building systems of learning to support that transformation. Prior to forming Kaufman Strategies, Kathy was a principal health management associate, where she worked with state Medicaid agencies, county government, Medicaid managed care plans, and health systems across the country. She is deeply knowledgeable about designing and implementing transformation projects that can drive change in the healthcare delivery system and across the community. And she has more on her webpage, Kaufman Strategies, if you want to know that. The thing that's not on her page is across the 9 ACHs, she is considered the most fun consultant that we work with. So she is able to take complex Medicaid work and turn it into a way that you can actually have fun dealing with complex Medicaid work. And that is a feat in itself that should be put on her webpage.
John, that's the best introduction ever. And I'm just going to need you to put that in writing and get it notarized so that I can have it hand delivered to Bruce and our colleague Diana.
I think the other thing I'll share is what I've asked them to come present today is on a social care network concept that has been in discussion across the 9 accountable communities of health. And this is really looking at a concept framework to support our nonprofit and community-based organizations and how they deliver services in support of the social needs of residents. I would really say that this is really a high-level concept that we've been working on. This isn't a formalized structure that we are operationalizing across the 9 ACHs, but really getting that high vision set and how we are thinking about supporting social needs across our community. So what you'll see is a shared vision or shared concept of how our ACHs want to do this work. What you're also going to see is Becky Betts from the COO from Greater Health Now is going to come after these two and present and share a little bit of how Greater Health Now is doing community-based care coordination and this work in the region. So the goal is ultimately to hear high level across the state how this is being visualized, as well as seeing an example of how one ACH is doing this work, so that as we are continuing to engage in these conversations locally, we can learn and understand the conversations really across the state and apply that to our work locally. And with that, I will turn it over to Kathy or Bruce, whoever would like to speak first.
Thanks, John. I'll kick us off before handing it off to Bruce. So hi, everybody. Really nice to be with you today. As John mentioned, we're going to walk through this high-level concept we're calling a social care network model in today's presentation. But as a segue to that, let me just share a very brief waiver update. As you all have likely already heard, the state has submitted an application to the federal government, to CMS, for a waiver renewal. They're expecting to get approval by the end of this month at least for a number of the elements in the waiver, including this idea of regional community hubs to be led by ACHs. This concept, the community hub idea, really came from the ACHs. It's a real shift in how the state agency has been working with the ACHs. In the past, the work of the first waiver was a lot more directive, with the healthcare authority, laying out plans for the ACHs to implement. This time around, the healthcare authority was really open and receptive to the thinking that the ACHs brought to the table, their lessons learned from the first waiver. And so really all that you will see in the waiver renewal for ACHs really comes from the leadership of the ACH executives themselves and the concepts that they brought forward to the state, because the first 7 years of the first waiver really gave them a lot of information and helped them figure out where is the true value add for ACHs in each of their regions across the state and all together collectively statewide. So with that, let's launch right in. Oh, we've got our little graphic. You can, Carolyn, go to the next slide. Thank you. Okay, so starting from the beginning, state Medicaid programs, not just in Washington, everywhere around the country, have been increasingly focused on addressing social determinants of health over the last decade, especially. But again and again, in every state, in every region, see a lot of good progress, a lot of good programs, but efforts continue to fall short of the need. There are a number of reasons for that. I mean, usually what's tried is a small set of services for a small target population. So a drop in the bucket compared to need. And even for that small target population, most of the folks who are eligible for these kind of services aren't identified or engaged in care. The communities themselves have little to no voice in how these services are provided or designed in the first place. And then the underlying financial structure just gets in the way of really taking to scale and replicating any efforts to address social needs as part of a Medicaid program. Next slide. We also know in every place across the country that the network of community-based services also needs to be strengthened. CBO partners do a tremendous amount of good work with very little resources. But the fact of the matter is there just aren't enough resources available in most communities to meet needs. A lack of systemic data means we don't even have a true understanding of what gaps are at any given time for any given population in any given community. The services that are available tend to be fragmented and uncoordinated. There isn't a real system of care for social needs. You got a lot of wonderful organizations doing great work with the resources available to them, but no organization, no systemic organization of them all. And so as a result, multiple organizations in every community, they create care coordinator positions, right? Everybody's got a care coordinator position because it's so complicated to navigate, even for the organizations themselves, let alone clients. CBOs are also forced to chase funding and compete for limited resources. They're forced to compete with each other when the reality is none of them are getting the resources that they need. And they also tend, at least the smaller ones, tend to lack administrative capacity to work with a managed care organization or a healthcare delivery system to be able to hold a contract, bill for services, or manage any payment at something like a population health level or other value-based payment arrangement. Next slide, please. So our thinking with all of the ACH executives is that there really needs to be a managed network model for social care. Right now, we don't have an organized network connecting health and social care. We don't have sustainable financing. Financing is disconnected from value. The way social care is paid for is radically different from the way healthcare is paid for. The way it's paid for is disconnected from Medicaid, and there's still a very limited understanding of the impact specific services have on population health. Next slide. So a better way would be a model that would bring all of these things to the table: a coordinated no wrong door approach, a network of community-based providers that's supported and managed by a backbone entity, a uniform social needs screening and closed loop referral, expansion investment into the community-based workforce. We know community health workers, peers, other types of community-based workers are a key ingredient for success, along with increased investments just into services themselves, metrics, reporting, and evaluation, and a financing model that's sustainable. Next slide, please. So really, we think a way to think about this is a social care version of an IPA. Those of you who are clinicians or work in healthcare delivery will be familiar with an IPA, an Independent Physicians Association. But IPAs were developed so that smaller practices could have a way to band together and contract with managed care or other health insurance plans. Next slide. So we're calling this approach a social care network approach. You can keep going, Carolyn. So a social care network would formally organize the community-based organizations into a regional equity-centered network of social care providers and create a single point of contracting for social care needs. Contracts with MCOs in the region for Medicaid services, as well as with the state Medicaid agency for people who aren't in an MCO, they're enrolled in fee-for-service. The social care network would work with the MCOs to work through payment mechanisms. They would also connect people to community services beyond those that are covered by Medicaid, right? There's also SNAP, TANF, a whole array of community-funded services in every region. A social care network could also monitor network adequacy, which is a term that health plans use to talk about whether or not their provider network is adequate. Do we have the right number of primary care providers in all of the regions we need to have them for the size of our population? A similar view can be taken with a social care network. And then lastly, the social care network would also monitor performance for the provision of these social care services so that the community can have a transparent view into who is getting what, when, and also what gaps remain and what impacts do we see from the services that were provided. Next slide. The social care network would coordinate and work with MCOs as well as any other health plans and providers to develop easy referral systems and a uniform social needs assessment. They'd provide community reporting on utilization, outcomes, performance measures, and community resource gaps. And then another really important part is the social care network as a backbone entity doesn't just provide funding and require reporting from community-based organizations. They also help to continue to strengthen and empower community-based organizations by providing technical assistance and support, helping them adopt and utilize technology, technical assistance and training around business practices, including billing and payment, service delivery integration, helping them create and adapt workflows, quality improvement, and more. Really, the list of support would come down to what do community-based organizations in your communities want and need. Next slide, please. So in a social care network model, MCOs continue to coordinate care. They just have an additional partner to assist in that work. MCOs are not going to want to stop coordinating care for patients who have extremely high complicated medical needs. And we don't want them to stop. It's important that they coordinate that care, especially the clinical care. But a social care network can bring more organized, easier to navigate connection to the social care resources those patients might need. Bruce, do you want to walk us through values?
Sure. So greetings, everybody. Glad to be here. Always anxiety provoking to follow the fun one. It's going to be all downhill from here. I apologize. But I just want to walk through with you some of the values of this social care network. We really think that there's a value proposition to communities, to managed care organizations, to clinical providers in an area. The value to communities is really something Kathy just outlined. One, supports and provides technical assistance to community social service organizations. Any of us that have tried to work with as patients or as providers with healthcare organizations know it's a really complicated system. And this provides technical assistance to help navigate that, can provide the administrative infrastructure to smaller community organizations that need it, this is a big one, really allows communities to better understand gaps in services. When you have a central place where organizations are working together, it makes it much easier to understand where the gaps are in services in communities. And it helps to sustain the community safety net. Next slide. There's a value to MCOs in this. Rather than contracting with multiple community-based organizations, they can have a single point of contracting that eliminates the need to negotiate with multiple providers and really provide some administrative simplification. There becomes no wrong door for care coordination. You can access and leverage other community services, not just limited to Medicaid-funded services, get support for engaging members with complex social needs. An organization like this serves the whole community, not just Medicaid. We know people churn on and off Medicaid, and this allows people to continue to be served even when the MCO isn't providing coverage. Whole families can be served. We know that there's a lot of circumstances where only children are covered. There's one source for data on quality and access to community services. One of the big pieces of this new waiver is an infusion of hundreds of millions of dollars into Washington State to provide some of these community-based services. With that, however, is going to be an obligation to do reporting, and this provides a better way to centralize reporting and get information back to the feds. And finally, there's really a potential here to lower the total cost of care and to make people healthier. If we do believe, and we certainly believe that it takes more than just medical care to have people healthy, that it requires a variety of social supports, that providing that and coordinating that will actually lead to healthier communities, healthier people, and lowering the total costs of healthcare. Next slide. There's a value to clinical providers in the area. Provider networks will see much the same value as MCOs, but in addition, they'll get some assistance in improving the health of their population and ability to manage complex patients. When I was a practicing physician, I would have loved to have this kind of an organization helping provide care to my patients. Can help reduce what is known in the industry as social admissions that aren't getting reimbursed. People who are in the hospital as a place of last resort. Now we can help reduce some of those admissions by better coordinating this care, reducing social bed days and delayed discharges, and a potential to help reduce preventable admissions within 30 days. That's a big criteria that health plans need to abide by, and this would help them do that. Next slide. There's a value to this for the state Medicaid program. It brings value to the state through a more systemic approach to addressing health-related social need. It provides a better way to manage health-related social need locally. It really builds a community-based, community-governed infrastructure and a mechanism for easier contract management, one-stop shopping. And, we think that with the information and experience that you gain during the next 5 years of the waiver, that Washington can shift to even a more innovative population health payment model for social needs. We haven't totally figured out how best to pay for social care within Medicaid, and this will help. Next slide. There's a value beyond Medicaid. Certainly creating this within communities creates a venue to help other people, particularly elderly on Medicare, who require a variety of social services. This is not a network that is restricted simply to Medicaid. It helps the healthcare authority and other state agencies, local government, and philanthropy. It provides ongoing support for a population that moves on and off Medicaid. And, lastly, creates a sustainable community-based infrastructure that can respond during public health and climate emergencies. We've certainly seen that with COVID. We see it with wildfires. We see it with heat domes, that an ability to quickly mobilize social services would be possible with a network like this. Next slide. So, achieving the vision, how do we move this forward? The taking action for healthier communities, that's really the initiative in Washington's waiver renewal, provides the building blocks to do this and can provide the funding for this. It provides funding for regional community hubs, for community-based care coordination, strengthens and it has an increasing investment in the community-based workforce. And we hope that there'll eventually be some equity fund investment. All of that can form the basis for this local infrastructure. Regions can start small and phase in over time. It's going to take time to truly understand and quantify community need, to have input and buy-in and show value to all the social service organizations in a community, to build the community hub, etc. But this can be something that really can help amplify and add, greater outcomes to the state's 1115 waiver and to the work that you're doing locally to provide many of these health-related social needs to your population. So with that, we'd love to dialogue, take any questions you may have. And Kathy gets the hard questions, I get the easy ones.
All right, Kathy, maybe this is yours. We are already doing a lot of this work by kind of various regions, even regions within the county, because each local area has its own resources and own relationships. My question to you is, how do you take already what we've been doing and working on and making sure we don't lose those people from that good work? That's my question. First question. And second question is, I've been fighting specific MCOs with measures that we have clearly helped them reduce cost, but they are frankly not willing to collaborate. So how do you overcome that? I don't think that's going to happen without a state coming from the healthcare authority.
Yeah, thanks. Those are two really good questions. So first, the really important thing about, wait a minute, we've got communities For us, it's really at the county level already doing a lot of this work. The last thing you need is somebody, especially with a statewide view, coming in and messing with what's working. And so I would say that that positively can't happen, right? The whole idea of the community hubs in the waiver renewal through the state, and then very clearly in this broader vision of a social care network, is that communities know themselves best. Approaches have to be regional. Approaches have to be worked out with the partners who are there on the ground doing the work. And so under this model, there's a lot of flexibility for every community to figure out what's the best way to approach it. What this model brings to the regions who are already working like this is some connection to other places across the state doing the same kind of work. And most importantly, a large investment through the Medicaid waiver renewal for expanded workforce capacity in communities, for some expansion of those social resources that already exist, and an organized network way for different communities to work with each other.
But let me,
That's
I think
question one. Yeah, Bruce, go ahead.
the second question actually also answers the first question.
Yeah.
Which is, I think what you get with an association of social care providers is leverage in negotiating with managed care organizations. You're no longer negotiating and dealing with contractual issues one by one, where you simply become a one-off. I used to run a managed care organization. I know how this works. But when you have every social service provider in an area negotiating as a group, you now have some leverage on timely payment, on what you get paid for, et cetera. And so we think that this kind of a network empowers and really helps local community providers that are existing. It augments what you're already doing. This is a kind of a model that small 1 and 2 physician practices have used for a long time in being able to negotiate with managed care organizations for exactly this kind of reason. So it's not meant to supplant what you're already doing. It's actually meant to provide you with greater technical assistance, be able to leverage all the work that each of you do, and quite frankly, an ability to get paid for what you do and be able to do more.
Yeah, and I would add to that, the other piece is the healthcare authority clearly sees value in these regional community-led approaches, and also value in making sure that the kind of governance and oversight of how social care is delivered is really put in the hands of the community, not just up to each MCO. So I think the state is really interested in this waiver, in this work, figuring out, well, what might they require in MCO contracts around paying for these kind of services or in ways of working with these hubs. So it's not just voluntary.
And I don't disagree. I think it's got to be a little bit higher level on, for instance, during COVID, we saw that the schools provided a large portion of food equity. Who said the schools should be doing that? Like, first of all, do they have the expertise? Do they have the infrastructure to do that?
Yep.
I would say no for many of the reasons why. How come they're left to do this? Why are they holding the bag? And shouldn't we have a bigger plan from the top? So I agree with that. But I also have concerns that, a lot of infrastructure and work has been done at the local level. I just don't buy the MCOs. I just don't buy it.
Yeah, no, I hear you. And, let me just say that the first year of the waiver is meant to be a planning year, because I think every community has a similar situation and needs to sort through how does the community want this to work? So there's time built in to allow every region to figure out, what does the community governance structure look like? How do we want to organize ourselves? What does the community want us to build in? What does it not want us to build in? I'm not saying it's going to be easy and be a magical unicorn and everything will work perfectly, but there's a process for every community to work through. And I think a real golden opportunity for every region to build something up that can be lasting.
Great. The other comment I'll throw in to keep in mind as you hear the social care network concept is that not every community-based organization or every form of community-based care coordination should or would go through like the managed care payment model, right? There's going to be certain instances where trying to do that is just going to create more of an administrative burden and headache than it's really worth, and the value that that organization is bringing by providing the services at a very low cost that really has significant impact should just stay that way. And in ways, but that would bring us another form of helping connect them to the broader picture, and then helping to support them in other ways to keep that good work going. So it's, sometimes I see like there's almost like a specific subset of community-based care coordination that's really like managed care, paid community-based care coordination, but then there's a lot of other work out there that's community-based care coordination that probably won't, and in a few instances shouldn't go through managed care. It's gonna be detrimental.
We've been saying no wrong door, but not gatekeeping. No wrong door doesn't mean only one door and no one else can have doors open. Peter, I see your hand.
Yeah, I mean, as a veteran of the MTP project and the hub model that we all signed up for, I mean, this all sounds very familiar in terms of the reason to do this. And I'm just wondering, having seen that process, get tried really hard and abandoned, what would we do differently? I think what was the attraction there was we had a methodology, we had software, we had a whole package that looked like we could just implement it. So what did we learn from that, and what would you think we would do differently?
Yeah, excellent question. My take on it would be, in the first waiver, this ability to do a pilot of the Pathways hub. The challenge was, I don't know that it got the support it needed to succeed. It was one of a long laundry list of things that ACHs needed to accomplish. Not every ACH opted to implement a Pathways hub. I think that in this approach, in this waiver, it's sort of agnostic about platform. Each community is going to have some leeway to figure out what they want their structure to look like, but every region is going to have a community hub. There is going to be a contractual relationship with the MCOs, and there is going to be significant funding to stand up operations, expand operations if you've got something in place already, and make very sizable investments into the community-based workforce, not only for more positions or covering the cost of positions that already exist to free up dollars for other things, but also investments into training of that workforce and convening and doing shared learning for that workforce. Again, with the idea, just like in the network, building a network of community-based organizations to kind of elevate their voice and empower them, doing the same thing at the community health worker level. So I would just say it's a deeper, stronger statewide approach than in the first waiver. I don't know, Bruce or John, if you have other thoughts to add there.
Yeah,
Go ahead, John.
I messaged Deb and I see her hand up if she wanted to provide some thoughts, because I know she's been engaged in these conversations as well as the past pathways. So Deb, would you mind sharing anything?
Hi, Bruce and Kathy. It's been a while.
Hi, Deb.
I'm sitting here listening and thinking to myself that the conversations pre-COVID really landed in a good spot with you all, because what I'm seeing on your slides is really what our organization has been doing with the Healthcare Authority, with the Health Home Program, for sure. We are that perfect example of a hub in the Health Home Program. We're called a lead, but it's the same thing. We're the example of, we go through the pains of contracting and receiving payments from payers. Now we have, I got to think about it, 5, 6, 7 contract organizations that have the community-based boots on the ground. They don't feel those pains.
Yep.
They don't know that they're getting paid. Some of them do. That's a little bit of an exaggeration, but
Right.
they don't realize, right? Because they didn't have to contract. All they do is hire the staff and meet the expectation of the contract. So I appreciate, it does feel like what you're talking about is what we've been doing already.
Yep.
The other thing that I find really fascinating for some of the North Central Washington folks who have been here for a long, long time, the community choice organization started in 1994 because there were independent physicians that needed to group together in a network to be able to contract with payers. That's how we started. But affordable care forced them all together into these larger healthcare systems. So what we really need is the new network of the community-based organizations. So I appreciate what you're saying. I'm excited. There's a lot of work to do, and I'm 1,000% with Ray. We have 6 new payers in the Health Home Program, and it's a nightmare.
Yeah.
It is a nightmare. So I need you all to push the MCOs, because it's not as easy as the leadership thinks, right? It's one thing for leadership. It's another thing for their staff to come make our lives miserable. And that's what Ray has been trying to deal with too. So
Yep.
thank
No,
you.
totally understandable.
Mhm.
You all should know the ACH executives are working with all the leadership of the 5 MCOs and some of their staff to figure out how to make contracting between them through these hubs work.
Either the
Bruce, were
only-
you going to add something? Sorry. Oh, sorry,
Oh,
John.
go ahead, Bruce, if you want to.
No, that was a great discussion. I think, no need to add on.
Other,
So I have a question
go ahead.
I could ask. So my question is like, how would the money flow? Because I'm very curious, like if the funding would go through to the MCOs to set up the support hubs, or is it going to go from the state directly to the hubs, and then they contract with the MCOs with some guidance or brackets set up by the state?
You all are asking the smartest questions. So really important question. For the waiver, most of the funding is going to come directly from the state, from HCA to the ACHs, with the idea that there are also some funds that come from the MCOs. But the majority of the funding will be directly from HCA, smaller bucket from the MCOs, with the goal really being, let's just figure out how contracting between the ACHs and their hubs and the MCOs can work. Let's just start somewhere, because it can grow over time. And again,
So the ACHs are responsible to develop the hubs then?
yes. And each
Okay.
ACH has the leeway to figure that out in whatever way works best in their region, right? There's no reason why an ACH couldn't decide, we actually are going to delegate a lot of this to an entity that's already doing a lot of hub work.
Yeah, Dr. Tuggy, I think the one thing to be clear on for us is, us as an ACH chose not to take on pathways. We chose not to take on even COVID Care Connect. And thank you, Deb and Action Health Partners, for venturing down those fun rides with the state. And that's, for us, we're really here to still act as that facilitator, and there's certain roles in the social care network we can act on as an ACH, but we're assuming that that's really a collaborative effort of multiple partners in the region. And so that operational component of the vision may look a little bit different from ACH to ACH, but the vision is still to provide that network to support the social care providers in our region.
Okay. Yeah, because I have to say, if the funding was going through the MCOs, I'd have huge concerns. But since it's going to go to the ACHs, it feels like it's a lot more accountable. What's going to happen with all that resource?
Yep. So I will just add, so the ACHs, there's obviously a lot of work that will need to happen in each region to figure out what's the right structure and approach to governance, what's unique to each community. There is also planning happening across the 9 ACHs so that they can really collaborate and work together on the pieces that are going to require statewide standardization. So we've got more of the ACHs telling HCA how standardization should happen rather than the other way around.
Well, that's comforting, Kathy, because in the Pathways Hub, what was attractive was the standardization and us learning and doing things together, and the thought of everybody making up their own infrastructure, software, that sounds terrifying.
Yes. Yeah, would agree. I mean, it is this special balance of where can you make sure you're getting the value where standardization brings value, but you're not losing the value of regional community-based approaches, because every community is a little bit different. So I think the intent here is to make sure you're maximizing the value out of both those things, because both approaches bring value. We're excited for you all. I mean, it's been a joy and a privilege to work with the executives on this concept. And I've been working with ACHs, the collaborative of them, individual ACHs, even the state on the first waiver going back to 2017. And this is the first point where it feels like, oh, there might be some magic getting captured in a bottle here. That what's being developed makes sense. I don't know that it always made sense to have ACHs working on HIT and value-based payment when the MCOs were the ones who owned those contracts or trying to move the dial on very clinical measures. It feels like the right role for ACHs has emerged. Their lessons learned over doing the work in their regions over the last 7 years. And we can tell you, as folks who do a lot of consulting in a variety of places on Medicaid, a number of other states are scrambling to catch up to Washington, because it's clear the future of Medicaid is going to have a greater focus on addressing social determinants and a greater need for some kind of regional infrastructure, because you got to figure these things out at the community level. You can't have every program designed at a state level and expect it to work in every region across a state.
And this really does empower community organizations. And I think we want to get away from medicalizing the services that are provided by community organizations, but rather to strengthen them. And this really plays to that.
Are there other questions of Kathy and Bruce? And for the whole board, the other thing I would throw out there to remember too is, even though the waiver the goal is the waiver to get signed at the end of June, we're really going to be moving into a planning year in these conversations. So this is really a start of more to come in regards to how this is going to get built out and how we look at doing this work in our region, including folding in those partners like Ray, Deb, and others who are really doing this work to make sure that it works for our region. So Bruce, Kathy, I really want to thank you both for your time. You are welcome to stay on to listen to Becky. You are welcome to stay on to listen to the rest of the meeting if you'd like to. You are not required to stay on if you don't want to.
I got to sign off, but we'd love working with you and look forward to continuing that on into the future.
Perfect. Ken, do you have one last question for us?
Yeah, I do, I guess, and sorry to looking this late, I'm trying to catch up here with stuff. I guess one of the questions that makes me nervous about hubs is partially due to our own experience of and challenges that we had in years past, but I worry about things like governance and oversight and control. And are we talking about with hubs working primarily with MCOs, or are we talking about funding being directed from state government to the hubs to be subcontracted to community-based organizations? And when we do that, that control gets put pretty much entirely on the hub, so to speak. And I'm a little concerned when I hear things like that.
Yeah. Yeah, no, really important question. So for the waiver renewal, most of the money will come from Healthcare Authority directly to the ACH, the hub and the hubs, right? With some dollars being contracted with MCOs. But I think one of the many things each region needs to figure out is, what does their hub governance look like? Because in order for a hub to be successful, it really needs to have a level of community governance that will help it succeed. And I don't know that there's a one size fits all approach to community governance across the nine ACHs. Some ACHs may decide their ACH board or whatever governance structure they have fits the bill. Others may decide that's not sufficient and they need a separate governance structure over the hub. So I think those are the places where each region is going to have a lot of control over deciding how they want to make it work.
And Ken, we've talked a lot in our region about a decentralized structure and how we can really create governance around that. So the concept wouldn't be really one entity, overseeing all others and dictating everything. I mean, even when you think of a concept of an IPA, it should be beneficial to all independent organizations, and they should have an input on how the system flows across that organization. So if the system isn't working for one piece of it, they should be able to have ability to provide voice in it and gravitate and direct that. What we don't want to create is, basically a mini MCO in our region who can then dictate and tell everyone how things are going to be done or not get paid. No offense, I'm sorry, Maddie, that I know that's not what the MCOs do, but just as a broad example for Ken.
Thank you.
So again, thank you, Bruce and Kathy. And up next, I want to introduce Becky Betts from Greater Health Now, their Chief Operating Officer. And Becky, I told Bruce and Kathy I tried to find a bio online, and you are even worse. You have nothing on your homepage. But I'll just say we've gotten to know Becky through her transition. She was originally over at Providence, and as Greater Health Now was taking on community-based care coordination more, they had the opportunity to take Becky on their team, and she's phenomenal. There's, I know Caroline's worked closely with her, and there's no other great individual to have down there south of us as part of our Eastern Washington group to do this work. So Becky, I'm going to turn it over to you.
Thank you. Well, when we do get our website up and running, I will know who will write my bio. Thank you, John. Can you see just the slide deck, just the cover page, not my notes? Or do you see my notes?
Yes,
what do you see?
It's the correct screen.
Yep.
Presentation
Excellent.
mode.
Thank you. I usually have heard an entourage of handlers to contain all this energy and make sure I have the right presentation. Oh, you guys, thank you so much for your warm invitation and invite. And thank you, John. That was very sweet of you. I am Becky Betts, and I am new to the ACH landscape. I did join Greater Health Now full-time in January. Just a little bit about myself. I am from Walla Walla, Washington. I am a lifelong resident of the Walla Walla Valley. I am the descendant of two pioneer families that settled here in the mid-1800s. So clearly I'm here probably till I die. Prior to coming to Greater Health Now, I did work for Providence for 32 years. My last gig, I ran population health integration and case management continuum, both outpatient and inpatient, for our Southeast Washington service area. I'm a nurse by training. I have a experience working on community boards, very familiar with hub and spoke models and care coordination delivery system, indirect and direct. I've been told, well, my favorite word is community, and tongue in cheek, I've been told that was my first word that I spoke, even before mama or dada. I knew my place was for community, in community, and with community. So it really feels like a coming home, so to speak, to come to an ACH. This is my world. I just love partners, community coordination and care coordination. I've been doing this work in some capacity my entire career, in the streets, in the shelters, and in the C-suite. So I really do feel like I have seen all sides of the rock when it comes to this work. Again, thank you for this invitation. I have found my best friends at Thriving Together. The warmest welcome, John and Wendy and Joy and Caroline, and those at Action Health Partner, Deb and Cami and Diana. You have really good people in North Central region. Your spirit of generosity and kindness towards the new kid has made all the difference. Bruce and Kathy are a hard act to follow, but I am thrilled to showcase the direction Greater Health Now has chosen to come to as we build a hub. And, you know, I just want to really echo as I present my slides that this is going to be the direction of your own community voice on how you take this and what type of hub and how you want to slice and dice this and to keep it true to the authentic flavor of what works for Thriving Together and your county and your partners. This is the direction that Greater Health Now has chosen to go. We are alike you, but similar, but different. Greater Health Now, formerly Greater Columbia Accountable Community of Health, did not have a hub. They did not have a Pathways hub. That was not a scope of work they chose to take on during MTP 1.0. Providence had the Care Connect hub, similar to House Action Health Partners. So when I came on board, we have made the decision to build a hub, and this is a story of our journey up until now. So I'd like to share before we get started the definition from a partnership to align social care that I really keep as a North Star. A community care coordination hub has trusted relationships, understands the capacities of local community base and healthcare organization, fosters a cross-sector collaboration that practice governance with authentic local voice. That is a caveat right there. For your situational awareness, for those of you who don't know, this is my span. These are my people. We are your neighbor to the south. We are the largest ACH by geography. There's a lot of care coordination going on in this vast area. We have samples within these counties of centralized hub, decentralized, distributive hub. And, you know, now we have a collective of this directive that we are responsible to get some sort of regional care coordination hub. So what is our work? Prior to me coming aboard BB before Becky, in 2022, Greater Health Now hired Tenfold Health Consulting to really assist in developing a framework for what their definition of this work would be. So Tenfold started working with the organization in August and did a massive amount of interviews throughout the 9 counties, starting to do that pre-landscape analysis of what this should be. What could we learn from the communities? What ideas? What's working? What's not well? What does Greater Health Now need to build a capacity and expertise? There was also a recommend from Tenfold that they hire a chief operating officer, moi, to round out the executive team. And as a condition of my employment, when that phone call came, I felt very strongly that Department of Health Care Connect contract come with me. We had the staff, the expertise. We had been doing it since the beginning for a couple years. It didn't make sense to keep that at Providence, but go ahead and kind of bring it home to the ACH. And that it did. On January 1st, Greater Health Now assumed that scope of work. This is what I came to. Again, I've been there since January. When I arrived on the scene, I was very grateful that we had these interview summaries. But to Ken's point, I saw some potential pitfalls. You can imagine if I would just come in and get a hub advisory council and we got to town, because I was hearing pretty loud and clear that there were voices in communities that said, hey, you know what, don't break what's working. Don't steal our cheese. Don't mess with our swim lanes, don't rebuild the wheel, don't replicate and duplicate and all of the above. And that's my game. I don't like waste. I don't like duplication or silos. It makes no sense. And I really wanted to honor what was working in the communities and working well. But then, you know, this area is so big, we had other sections that didn't have a thing. So, you know, a rising tide lifts all boats. We have a tremendous challenge to enable smaller community-based organizations that lack that organizational capacity and resources to participate in contracting opportunities and true well-oiled care coordination machines. These are just direct quotes from of our consumers. They really felt that the region came together during COVID. They saw resilience. They want, you know, the rally cry was, let's go further upstream. There's more than enough work to do, just not enough contracts. How do we systemize what's working? How do we systemize people? I feel like a tremendous gift coming to Greater Health Now from the belly of the beast, from somewhere like an acute healthcare system, where I am fully humbled and honor of the work our community-based organizations do. Working with those health-related social needs and social determinants. You can't do that. You can't fix homelessness and transportation and getting someone a pair of shoes and all that in acute hospitalization and the taxing of an emergency department visit and all of that which our health systems face and our clinics. We need our community-based organizations and we need them to do good work, and the time has come to reimburse them and celebrate them appropriately. And I just really find that exciting on how to build this multi-stake ecosystem. Our CBOs, we have interviewed lots of them through every 9 counties, and the themes, common themes are emerging. And I suspect these themes are probably going to be the same for your region. CIE, multiple platforms in use all over, and they are beholden to multiple reporting agencies. No one seems to, you know, have unlocked this interoperability. Sustainability, we're all working up again. They're all working against restrictive funding streams, really beholden at the next expiration of a grant or philanthropy cycle. They're doing an awful lot of unpaid work. Would love an outcome-based payment, would be a great lift. Successes, the successes by and large, when they have carved out those partnerships and they're working in unison and in the same trajectory, when they have MOUs, when they're sharing some staff and some services, I think where you see where this is going, they're collaborating, they're trusting. There's some that have this community case conferencing figured out. Barriers, again, it's the data sharing capacity, lack of funds, and realistic deliverables for small agencies. So it's kind of this wish list. I also have this printed out and taped in front of me as things to tackle. So what did we do with all this information moving into 2023 and what's coming for our waiver? We decided to go ahead and have a hub formation task force, kind of as that soft walk. Before we dove into deep into the pool, we thought this would be a very prudent move to go ahead and assemble a task force to get us to that point, to get us, to advise us, to guide us with the goal of helping us explore the way we could build a hub that works for our region. So we're continuing to interview our CBOs across the 9 counties. Those interviews continue as well as interviews with our MCOs, because all of it's going to contribute to the pot. We are highlighting our local successes and challenge and innovations that will serve as a framework for this hub development. And eventually this will funnel into a true community hub advisory board. The CEO will report to the board of directors on our progress. So we designed this hub formation task force with, it's time limited, a series of 6 meetings. It has specific deliverables. We have an action pack 2-hour meeting every month, but we don't want this to go on forever. We know we have big work to do, and we want to get to the place where we have a hub identity. We have a place where we know what type of value proposition we have. We can explain and articulate in kind of that one elevator speech to all of our counties. And I'm just very appreciative of the task force that we assembled to help us get there. Obviously, it's very important to have a voice from every far-reaching corner. We wanted to select the most innovative thinkers who are strategic, that can think beyond those county borders. So even though what may be working for their organization and their county, they could recognize that maybe some of our smaller counties needed help, and they were willing with curiosity to help us get there. We wanted people who had experience with care coordination. So on our task force, we have hospital and healthcare representatives. We have CBOs doing the care coordination work. We have our local health improvement network representation. We have health department, local health jurisdiction representative, and we have a MCO representative at the table as well. Types of discussion questions our task force addresses. How are community organizations and health systems currently intersecting in the communities, areas unmet social needs? What do people need but organizations can't provide? What are you using for intake or screening? And are there organizations within the county sharing administrative functions? So, you know, back to the idea of the social care network, which is beginning to get socialized and some attention, which I love. You know, coming out of Providence, I was very familiar with high performing networks and shared services. And, you know, it just makes sense. And it's a very intriguing proposition to me. That might be where we land, that is the value add, because time and time again, it's like, please don't make us refer to your office in Kennewick for somebody who needs help paying their power bill. I mean, that just sounds ridiculous, but maybe if we can provide that technical assistant and build a house and an organization from that wide angle 30,000 foot view that could help everybody get to that seamless place of propelling forward. Again, I think that's very exciting. Lots of discussion. For instance, our last task force meeting in May, we had every county talk about their referral, their care coordination system of how they can best see it, to share their intake form, what they do. And it was really telling. Some, you know, counties, like I said, completely got together. They have a hub and spoke built. It's beautiful. And then the other counties where not so much. And it was a valuable exercise to see the differences and where we needed to lift others up and kind of borrow in that shared learning. How will we know if this works? When we walk away in August and adjourn, what kind of product are we going to walk away from? Well, we'll know it works when we have a hub identity, and we know that we have a mechanism to address the health-related social needs, or those social determinants of health at an individual and population health level. We can identify that we are all playing at a well understood and widely supported role in the region, that we are advancing equitable health and well-being, that we identify and represent the interests of all residents, you know, with that lens of equity, and that we have some sort of long-term financial and administrative stability. And we plan on, you know, hitting a home run with Waiver 2.0. Now, are these big lofty goals? Yeah, early on, yeah, especially in this period of kind of gray where there's a lot of nebulous unknowns right now, including the final scope of work. But I believe this was a right direction of where we need to go. And I'm really excited about the progress. Kind of in closing, I've been sharing this with other boards. You know, should you guys, you know, some just questions as you think about what your own hub would look like, or what kind of community partners this work might be delegated to, who should be part of that conversation. You know, I can't emphasize how valuable it was, even before the task force began, having that landscape of all of those interviews and that voice. It's such valuable information, because it really informed the direction of where we start the task force, who should be on it, who could be most helpful. And 2023, how will this waiver add value? I mean, ACHs want to be a value add. We don't want to be a big nothing burger. We want legacy. We want to be important to our communities. And what do we want to accomplish in our communities, and what are the conditions against our across our communities that we can address collectively and share collectively. Again, round it back to that social care network. And in closing, one of my favorite picks and my favorite images, I'm kind of channeling that Greek mythology this Monday afternoon and the lesson of Cepheus. You know, I believe that the work of the people, especially managing Medicaid lives, often the most medically and socially complex in our communities, require the heavy lifting of all of us. We can't do this alone. Action Health Partners can't do this alone. Thriving Together can't do it alone. Ray can't do it alone. Rural Resources can't do it alone. We all have big work ahead of us, but I'm really excited about the roadmap and the direction Greater Health Now is going. And I know you have fantastic leadership, and you guys, you know, John and Deb and Caroline, Wendy know how to get a hold of me. There's my email address, but I look forward on following your own journey. So I really thank you for your time this afternoon.
Any questions for Becky on how Greater Health Now has been visualizing this?
Hey, Becky, thank you very much for that presentation. That was really helpful. I think I really appreciate your comments too about, you know, your background around care management and being involved with care management, nursing and things like that, because, you know, my biggest worry about a new you know, hub is how will that would enhance communications, you know, and I think that's the biggest challenge that I see between our social services and our medical community, is the inability for us to really communicate what's happening with the patient in more of a real-time format. And as you know, even within health systems, the ability for like care managers to communicate with the primary care team is often very impaired and not very well done. And so this is an even broader network of care managers and case managers and other inputs. And so I think it's going to be interesting to see what kind of tools we can develop, or even the state could provide or develop, that would really allow for much more seamless communications.
Yeah, and it's just been thank you for that comment. It's been such a big surprise. Part of my within my lens at Providence was managing our value-based care portfolios. And so every week I was on the phone to our MA plans, Medicare Advantage plans, and our MCOs working and, you know, trying to close those quality gates and those care gaps and those metrics. And, you know, just having the benefit of having Epic and real-time information on patients, and then coming over to ACH and everything is data claim, and it's not, don't even have an EMR. I'm so handicapped with that. I did remain on call for Providence, so I have Epic right here. So I would be strangled without it. So, but to not have that, but, you know, arriving over here and still picking up the phone, thinking I have, you know, those relationships with those MCOs, thinking that we all need to move in the same direction, and finding out that maybe the lens in the relationship is a little different. But, you know, to Ray's point, we have a cohort of community paramedicine programs that Greater Health Now is sponsoring 9 departments. And you know, Ray is just such an iconic rock star. We all envy his work down here so much, and we want to keep this going. I mean, this is such a future of, you know, healthcare is that important link of that community clinic linkage and what community paramedicine can do. And so it just naturally made sense for me to like get these MCOs to the table, right? So then we last month we had Molina. And I'm like, hey, look at this good stuff that's going. Would you be interested in kind of sponsoring the next cohort? And we had a great conversation with them, and they are willing to be at the table. But again, it goes back to the data. Like, you got to give us more than stories. You got to give us that meaningful data collection, that what your EMS programs, your community paramedicine programs are doing, because we got to be able to convert that. So now we're working very hard trying to revamp these milestones, and the challenge is to talk data that, you know, it's, I hear you. It all plays collectively and together, but I think we can do it. I mean, it's 2023, we ought to, but yeah, it's frustrating because, you know, it's out there. I know all this stuff's out there.
We almost need we almost need a vendor that's as good as Epic in some ways, but broader, that would be able to take in all the social services and support and, you know, housing and all that information into a hub and then distribute that out. When somebody needs that information, they can go to one place to look for it.
Yeah, yeah,
That
wouldn't
would
that be
be,
amazing?
if we
Yeah,
could, if we could find something like that would be great.
yeah, for sure. Thanks for your comments.
Peter,
So Becky, we hear a lot of concerns on the part of CBOs, and you brought a lot of them up about, you know, stay in your swim lane, don't, you know, reinvent the wheel. You know, concerns about coordination actually getting in the way of the good work that people are doing. On the flip side, what do you hear from the CBOs in terms of their enthusiasm about the possibility of better coordination? Do you have, you know, examples of what they're actually looking for and how they can see both their work and you know, the client benefiting from this? Can you speak to kind of what they want or what possibilities they see?
Yeah, they want paid for their they want paid for their work. And I had this conversation with Caroline a month ago. You know, it's such a hospital centric health system we have, where, you know, the payment is all going there all day long. And, you know, 80% of persons tell us that these CBOs and nonprofits, and we have one on every corner in Walla Walla, again, pushing the rock up the hill, and not, you know, their sustainability is just dependent on the next grant cycle. I mean, that's just insane. So what they're saying loud and clear is they're excited. They're excited that the Waiver 2.0 has the potential of having a payment methodology built in. They're nervous that how this is going to play out, because they worry that they're way behind the 8 ball. None of them have the billing technology. They're not really HIPAA compliant. That's what they're afraid of. Like, is this money going to start flowing in and we have no capability of billing? So that's where it's intriguing, where we don't feel like we're not going to steal the cheese by ripping out care coordination under them, but could we provide that technical assistance? Could we provide that shared contracting platform? To Deb's point, could we be that person that takes those contracts to figure out, you know, crack the nut with the billing, to have those conversations and negotiations with those MCOs? That's my world. I could do that, like, but could take that lift from them, because that's a lot to put on a little community-based organization that has never done that before. Yeah, so that's what I'm hearing from them, is they're really excited that potentially there'll be some revenue for this work and building out this community-based workforce. Because if there's anything we learned during COVID, it was that power of people that are not tied to brick and mortar. That's where real healthcare change and outcomes is occurring, is people that are on the streets and working with clients and patients that are very nimble and robust and can be very reactive. And we just need a lot more of them. So I'm so excited about the language in the waiver, and oh my gosh, I just hope and pray with all my might that it actually converts to change. Yeah.
and you know, Peter, your comment and a little bit of this reminds me too, is as we're doing this, we want to be careful that we don't end up creating a system where only the big players can play in it, and it pushes out the small, nimble CBOs that are doing this work well, because they can't develop those billing mechanisms. So we'll want to also be careful that we don't create this monolith of a system that's only done through managed care billing.
I am, just as an interesting caveat though, that we are, when we think about ACHs, and, you know, it's we are 1 in every 3 lives in our greater health now is a Medicaid life. So 1 in 3. But I'd like to think, if we are truly in the business of advancing population health, it's kind of that payer agnostic. We need to be doing it for all. Those Medicaid lives grow up and become Medicare and Medicare Advantage. I mean, it's all, again, it's all taxpayers, it's all our neighbors and our friends and family. So we are engaging in, I'm about to get something going with Primera, a commercial insurance plan, to do some care coordination, a transition out of a hospital. So I think the time is to even think broader. So I think everything's on the table right now.
And Caroline, I know you have some thoughts on how we're doing it in this region, so can you share a little bit about that as well?
Sure. I think listening to both Becky and Bruce and Kathy, you know, we've been planning over the last 2 years and convening conversations and work groups related to some of these building blocks that are needed for a community-based care coordination system to work well. So resource directories, IT platforms, and we've been thinking about it really holistically. So to Becky's point, we've been thinking about building an infrastructure that is payer agnostic, that is program agnostic, and where some of our CBO partners don't have a platform, can we invest in one, right? So we're piloting this use of Vision Link, which is still very much an experiment, right? It might fail, but it might turn out to show that it can not just track the great work of CBOs, but be able to do billing to MCOs or HCA. So that's one of the things we're piloting. And we invested some funds, for example, in Action Health Partners, piloting the use of Vision Link for the Health Home program. So there's a lot of things in play right now that I think will align really well with the future waiver. I think we're well positioned for it. We have this kind of network thinking, network governance mindset, which I do think will be critical to make sure that we make room for things that exist, right, Ray? Like what you were mentioning. And that is really tapping the wisdom of people who do the community-based care coordination, right? The CBO partners, whether it's community action councils, whether it's public health, or whether it's our smaller outlying partners like Lake Wenatchee Fire and Rescue. There's a way to kind of connect this whole system together and make room for everyone, make room for all programs, and then figure out what's the common infrastructure that we can build together, whether it's IT or resource directories. Like resource directory information is a huge piece of care coordination, like knowing where to send people. And it's been a pain point for so long. And we're kind of making some headway around both figuring out how to put the information into the hands of people, whether it's through a website or something else, but also invest in the human beings who need to update information that is constantly changing. And that's one thing we fail to do. And then we get annoyed that the website doesn't work. So there's a lot of things in play. And I'm really excited to kind of pick Becky's brain here and there, because I think there's a lot of similarities in how we're approaching the work. We might use slightly different language sometimes, but we're also thinking about, developing a community-based care coordination leadership committee that would be the voices of our network, and it would involve public health, and it would involve community action councils and our EMS kind of community paramedicine partners and action health partners and aging and adult care. So all the ones who do this work, different shapes and forms, would be at the table helping us shape it and guide the strategy and guide the decision. So I'll just stop there because I see that Teresa has her hand up.
Yeah, I've obviously shared with our ACH staff as well. From a public health perspective and the lessons we've learned through Care Connect. Care Connect came to our region very late into COVID, and it was very difficult. We have this public health mandate to provide care coordination for people in isolation and quarantine. Like just recently, I had a suspect TB patient who was homeless, and finding housing and food and making all those arrangements. I have the staff here now to help facilitate that. And so it's that balancing act with how we provide these services moving forward in a way that addresses our legal mandates. I'm not saying we're suggesting pulling it from public health, but I definitely see the value added. And I know DOH is talking with Healthcare Authority, because one of the stumbling blocks with Care Connect, when it was with an organization outside of public health, is they're not 24/7, 7 days a week, like we have to be in public health. So it's that marrying. And I know your region, you've got it all. You've got a real mix of health departments, and I know it's been a struggle for your region just with the sheer size of it. So we're definitely wanting to be at the table, and just, I guess, a different level of frustration, and we're also dealing with difficult diseases that really frighten those organizations that we're trying to work with. And then how do we handle the HIPAA situation and all those little nuances that come along with public health response.
Yeah, thank you, Teresa. And it was really important for me on the Hub Formation Task Force that we had the voice of public health at the table. As that you guys kind of re-equilibrize after this COVID and staff back up and get back to those foundations of community health, you are big players and you have an important voice, and we have got to partner and figure this out. So thank you for that excellent point. My partners at public health, as I've been touring this region, going throughout the 9 counties, it's some of my favorite stops, and good work being done there. But yeah, the Care Connect, and yeah, been a challenge.
Yeah, and Becky, I don't know from your experience, and I'm just kind of thinking the 10,000-foot view is, if I had to put 3 things to care coordination, is 1, every door has to be the right door, right? So that means you have to have all that resources that Caroline was talking about. 2, it's got to be delivered by someone they already trust and value. And so that's where every partner has to be doing care coordination to some sort of effect. And that means if they walk in to Manuel Navarro's team and they've been getting all the answers from them, they'll be trusted to actually make or take those resources with that. And 3rd is just communicating what the left hand and the right hand is doing. And I don't know. I mean, I know that's been done or tried in many states. I just feel like it's so painful. I want it to happen, but it's just so painful.
I love those 3 caveats, and I'm going to loop it back to just the importance of having also the MCOs at the table, because many of them have these regional care coordination teams. We can't forget about the interplay there. And just wearing my Providence hat here, I building out my team of community health workers and promotores, and the community paramedics, which were contingent employees of my population health department. So many just really just intense care coordination. We needed it was really frustrating to find if managed by a Medicaid or MCO life that, we have a care coordination, team, regional, we have, extra resources. So we got to loop all this in together. That's an important piece, but I wrote the 3 things down, Ray, because whatever you say, I take to the bank.
Well, we're a little over, so I want to just thank Becky for the time to come and present and share what Greater Health Now is doing for the board. Like I said, she's been a phenomenal asset to the team, and they've been a phenomenal partner southeast of us. And so again, thank you, Becky, so much for sharing what you guys are doing.
I will be watching. I know that whatever we come up with, it's going to look different, as it should, throughout the 9 regions in our state. So good luck on your journey, and I hope that I can come back or we can go have a celebration party. So, all right, guys, thank you. I'll be popping off now. Bye.
Thank you.
Okay, everyone, we're going to go ahead and take a 5-minute break and then come back and talk about vital conditions. So we'll be talking about vital conditions, belonging, and civic muscle. So, John.
So really, we shared at the last meeting a little bit of a summary around belonging and civic muscle and kind of the broader aspect of that specific vital condition. The one thing I wanted to just share today to keep at the forefront of your guys' mind, I'm going to do this in just a few minutes, is just a remembrance that this work is also tied to work that the federal government is doing. And so I put a link in the chat on the federal plan for equitable long-term recovery and resilience. And so this is a federal plan that got created post-pandemic, focused on how we are doing recovery. And there's a few things that I just want to call out for you on this as we think about next phases and how vital conditions and belonging and civic muscle relate. So I'm gonna speak, well, I got the wrong thing. Oh, no. I just want to share a few things on here. So, right, one of the key aspects of this is thriving. So, you know, this was also done in conjunction with community initiatives who we've been working with. So, you know, the federal government is again looking at thriving all people and places, no exception in the federal government, as a way to do this work. The other thing I just want to call out is as we're looking at the vital conditions and the work we do, you can see all the different federal agencies that are involved in this. So we're not just, CMS is on this list, but it's not just CMS. And this is part of the concept about how we start thinking of going broader in how we look at those vital conditions for health and well-being and ensure individuals are thriving. So you see Department of Commerce, Department of Education, you see the Federal Reserve Bank on here, the EPA, Department of Housing. So a number of these agencies are really involved in this work and figuring out how they link back to the vital condition. And I think the other aspect I just want to show is, as we were talking specifically about belonging and civic muscle, and you'll hear a little bit of what the NCW Equity Alliance is doing today, as well as Triple Point to Children's Home Society. You know, again, read through that general definition: a sense of belonging and power to shape a common world, including civic agencies, civic associations, collective efficacy, equitable access to information, freedom from stigma, discrimination, oppression, many opportunities for civic engagement. So really, how are we really thinking about infusing belonging and civic muscle into our work? And even as you've seen those state agencies, what you also see here is how they're starting to tie some of that themselves to the work that they're doing, whether it's through housing, whether it's through USDA and food programs, whether it's through SAMHSA, how they're looking at reducing stigma in the way that they do all of this different kind of work. And a lot of that is because, again, when you look at some of these statistics, you know, 1 in 4 of Americans 65 and older are socially isolated. 35% of US adults age 45 and older and 46% of US adults age 60 and older report feeling lonely. So we really do have this crisis of loneliness and lack of belonging that impacts all aspects of health. And there are multiple ways we can kind of fold this into all the work we're doing, whether we are thinking about education, whether we are thinking about healthcare, housing, and food. And the report itself, even as you go through and potentially look through, it will even identify ways you can look at lifelong learning and how do you incorporate belonging and civic muscle into those concepts of lifelong learning. So I put up a link to the full report in the chat. As we share out any future notes in that, what we'll also do is provide a link to the website, which provides the executive summary and recommendations that are a little bit shorter than 224 pages. But I do encourage you guys, as we go down the path of really focusing on thriving, focusing on those vital conditions and bringing these other partners, broader partners into this work, to look through some of these. I think what you'll see is being discussed at the federal level is also very applicable in how we're going to do this work here. And with that, I'm actually going to turn it over to Mariah to kick off the individuals who will be presenting to us today.
Thank you, John. We have invited Oscar from NCW Equity Alliance, and Dylan and Penny are joining us from Triple Point, North Central Washington. So without further ado, I will turn it over to Oscar first to present some of the great work that the North Central Washington Equity Alliance has been up to.
Thank you so much. Can you all hear me? Just doing a quick little tech check. Awesome. All right, I'm going to share my screen here really quick. I'm going to ask for another tech check, make sure that everything is working. Everyone can see my screen. So thank you all so much for having me here with y'all today. My name is Oscar Ricon, and I'm the Executive Director for the NCW Equity Alliance. And so before we begin our presentation, I do want to share a little bit about myself so y'all know who I am and I'm not just a person talking to y'all. And so a little bit about me. I'm the son of immigrants. I am a Chicano, which is a Mexican American. My parents are from Mexico. They immigrated from Mexico. And I was born in Orange County, California. We migrated up to Washington. My parents were field workers where they picked cherries and apples. And so I've been in the Valley since 97. So I was like 3 years old when I moved. So it kind of tells my age, which I feel kind of old sometimes. But so a little bit more. I'm the first in my family to graduate from high school. I'm also the youngest in my family. And so here in the bottom left corner, this is like, this is my siblings, my cousins. And so I was actually the first one to ever receive that degree. So to me, that was the highest achievement ever. However, I continued on with the journey. I was also the first in my family to go to college and graduate college. So graduated from Wenatchee High School. I graduated from Central Washington University with my bachelor's in accounting and supply chain management. And I went ahead and I got a master's in science in IT. So I did a little bit of everything. And to me, like, education was a big deal because a few people in my family were able to ever accomplish anything of this manner. So that's a little bit about me. And now we'll get started with the NCW Equity Alliance and who serves on the board. And so we have 11 board members, and some of those board members include Edgar Salamanca, Karen Francis McWhite, which I believe you all know her. She probably does a little bit of work with y'all. Elora Lashir, Claire Morrison, Teresa Bendito from Parque Padrinos, Dr. Ben Dunayak from Confluence Health, Penny Tabasca and Pat Whitfield are educators. Ashley Sinner is from the Chamber of Commerce. Maria Morelos is also an educator, and Mario Cantu from the PUD. And we also have Laura Gloria and Sasha Slayman from the city of East Wenatchee and Wenatchee as our ex-officio members. And so this is what makes up the NCW Equity Alliance board. And there's been such a great team to work with. I've also been very young to the organization, so I've been with them for about 8 months now. So we're still picking this off the ground, and it's been such an amazing challenge, and I'm very grateful for the opportunity. And so some of our partners that we've come across since the initiation of the organization, include Cafe, Community Foundation of NCW, Icicle Fund. I'm not going to read through all of these, but Indigenous Roots and Reparation Foundation, Our Valley, Our Future, Thriving Together NCW. So these are some of the partners that we've partnered up with so far, and others that have wasn't able to get them onto the list, but this list will continue to grow as we continue our journey as well. So super excited to be able to do different projects with some of our partners. So a little bit about our history, where we started. So in July of 2020, community leaders and influence met for the first time, aimed attentions around the community around COVID-19, Black Lives Matter, and the presidential election. So that's kind of where conversation started. In November 2020, a group of individuals surveyed 30 different public and nonprofit organizations and got an idea of who was doing the DEI work here in the region and at what level they were doing that work. What they ended up finding out was that there was a need for an organization that fosters inclusivityness, belonging for people of marginalized communities due to their race, ethnicity, gender, sexual identity, physical disability, nationality, or age. And so that's kind of where we got excited to get this started. In January of 2021, the group transitions into an organization, and they chose the NCW Equity Alliance as the name, and we appointed our first board members. In March of 2021, the NCW Equity Alliance interviewed 25 local leaders and nonprofit organizations to gain a deeper understanding of the DEI work in the region. And again, these interviews revealed that there was a lot of organizations that lacked expertise or couldn't hire a consultant to help them do diversity, equity, inclusion work. And so some organizations expressed that they were seeking to diversify their boards, but they weren't sure how to make that happen. And so the NCW Equity Alliance is actually leading one of Our Valley, Our Future's Game Changers, Diversify Leadership. And so we hope to be able to be a good partner to help diversify, different leadership, for example, like in boards or executive directors and other opportunities that may arise. So then in 2021, the NCW Equity Alliance signs a fiscal sponsor agreement with Our Valley, Our Future. And we're in the process of becoming a formal 501c3. The June 2021, the NCW Equity Alliance adopts its first work plan, and we're still working on that work plan. So it's been an awesome journey to be able to work through that. In August 2021, the NCW Equity Alliance received a grant from the Group Health Foundation, which is now known as INATI, and the Confluence Health for capacity building and educational programs. In September of that same year, the organization's first training, Learning to People Better Together, kicked off. So I believe there was about 27 nonprofits that registered, and it was a 9-month-long series. So it was all thanks to the Community Foundation, Icicle Fund, and North Central Accountable Community Health, now known as Thriving Together NCW, to help provide financial support and technical assistance. And I believe we had some folks that joined on that Learning to People Better Together series. And I'll probably call on y'all here in a few minutes when we talk about our 2.0 series. And I want to hear about kind of what your whoever joined that first series, what y'all thought about. So in August of 2022, the Equity Alliance receives a grant from the North Central Accountable Community Health, also now known as Thriving Together NCW, for our learning sessions and the hiring of an executive director in 2023, which that was for me. So thank you all so much for the support. In October of 2022, the organization announced that I was being hired as its first executive director. And so that was a really exciting time. And in that same month, there were some issues that happened in the community. So we engaged in advocacy work for the first time, where we issued a statement in support of the Drag Queen Story Hour held by the YWCA. And so that's part of our work that we're doing. And so our mission for the NCW Equity Alliance is to champion education, advocacy, and reconciliation through collaborative efforts. The NCW Equity Alliance supports diversity, equity, and inclusion initiatives across all layers of government, businesses, nonprofit organizations in Chelan, Douglas, Okanagan, and Grant counties. And so our vision is to create a diverse and inclusive community that is resilient, that values all people, backgrounds, and abilities, and provides a safe place for everyone to live, work, and play. And so we do that through our 3 pillars, which is education, advocacy, and reconciliation. I always like to think about this as a waterfall. So you educate, educate community to help advocate, and then the hope is to reconciliate. So to bring everyone together and be able to, to thrive together. So, we do a different community-based education programs. We also, as I mentioned, we've also advocates as well for the community, and we hope to bring folks together and reconciliate and have a good time. So that we always try to heal as a community. That's what we always like to see, and that's what we want and we envision. So a little bit of the educational work that we've been doing is the Learning to People Better Together series, which is one of our signature programs. We've also offered difficult community conversations trainings, making equity actionable, signature allyship, which is coming up, and belonging in the outdoors. So I'll get to those in a second. And so we, as I mentioned, Learning to People Better Together is our signature program. We launched the first one, I think it was last year, the year before, I think in 21, probably possibly, or 22. Correct me if I'm wrong. So we launched this year 2.0. So this is a 10-part series designed to help nonprofits, public or private organizations, and their leaders improve diversity, equity, inclusion with work within their organizations. And so if anyone has been part of Learning to People Better Together, I'd love to hear from you and what your thoughts are on this and how has this possibly helped you in your own organizations.
Oscar, for us, we participated when we funded it, and sorry to say that the 2 board members that participated aren't on the board anymore, so you're stuck with my perspective. But what I did appreciate, especially, and we did it in a virtual format, was even just some of the content and material and digging down and listening into it. To me, it's, as you talk about equity, a lot of times when you're going through things on, media channels, you get multiple perspectives, and normally they're very aggressive perspectives. So it was nice in the content that Karen put together to be focused and spend the time just reading and learning about it and reflecting on it, which was really appreciated. The worst or the less great thing was the fact that it was during COVID and it was virtual made it really tough to really sometimes have those conversations face to face, especially when you have conversations with groups of individuals that might, have slightly different views. So being able to have these conversations in the space where you're face to face is, and I know that I believe that's what they're doing now more so, is valuable in how you can engage and build those relationships. And I feel like relationship building too, and in these conversations are very, very important, because there are going to be times where people have conversations where they agree, and there's going to be times when they have conversations where they don't see eye to eye. And the more you have that relationship, the better you really can venture into these conversations.
Yeah, thank you so much for the insight, John. Yeah, so as John mentioned, this year we had a hybrid model, and so it just allows for more folks to be involved with this learning series. So we had 22 participants this year, and so it was I feel like it was a great success. As you can see, our first meeting was at the Wenatchee Valley Museum, so about half the group was in person and the other half was online. And so I really like the approach that Karen takes about looking at things like nationally, right? And then statewide, and then really just kind of focusing in then regionally and then locally. So it's really cool to just kind of see how that funnels just kind of an out to in kind of lens. And so she provides really great content, and we're going to continue, we're kind of continue tweaking this Learning to People Better Together series, and continue the learning, because we want folks to be involved and to learn all, different concepts, but like John said, right, to have these conversations, and sometimes you may not agree with, but to do it in a safe space to have those and in a respectful manner. And so that one has wrapped up at the end of May. And so we thought it was very successful, but I think, kind of moving forward, we hope to offer this more in person. We did, when we were in person, we did have deeper dialogues, and, when we were online format, the breakout rooms work well, but, sometimes off camera. And so we recognize that, and, we also recognize, folks are at different levels as well. And so, we just want to be that help in people's journeys through diversity, equity, inclusion. So another series that we offered was the Difficult Community Conversations. And so this one was a partnership with the Wenatchee Valley Dispute Resolution Center. And this program taught mediation skills for challenging conversations, including, communication skills, listening, conflict dynamics, peaceful problem solving, and how to identify issues. And we hoped that this will help restore some community dialogue and divisiveness across North Central Washington. So this one was a bit tricky. This one also wrapped up, and we've been working through this and we're slowly tweaking it. I think a big thing is that the Difficult Community Conversations title, I think when folks were signing up for this, they thought that they were going to come and have a difficult conversation around difficult topics. That was not the case. Our intention was to teach people the skills to how to facilitate those difficult conversations, whether that's in their workplace, during a community, literally during a community conversation forum, and to just be some of those just facilitators around difficult community conversations. So we're still tweaking this up. We hope to offer like a second part to this in the fall, September through October. And we're gonna do, this one was, when we first offered this is a 40-hour 2-weekend training. And so that is a long time. And so we found that doesn't work for everyone. And to be in, have 5 8-hour days of content is just a lot. So we're tweaking this up, and, we're doing 1-hour segments over 6 weeks, once a week. And it's going to be different topics. And so we're partnering up with the Wenatchee Valley Library to offer this learning series as well. And so we hope to lead this series up to a webinar that the library is having with Monica Guzman. And Monica Guzman is an author of a book called I Never Thought About It That Way. And so it explores, again, about having those difficult conversations within family, with people that disagree. And so we hope to have, that kind of build up. And again, the intention for this course is to teach people the skills on how to have these difficult conversations and how to just do them in a way that is productive. So a lot of learning through these different learning series. So another one that we offered was, which was a few weeks ago, it was making equity actionable. So this was a 2-part workshop. So part 1 happened in May. Part 2 is coming up later this month. But this one will teach, with the hope to teach how to implement a DEI plan within organizations, and how to measure progress. How to have how to be accountable, right? And so I think we had 2 folks from Thriving Together join this. And so if y'all want to chime in on what your thoughts were, what your experience was like, I know I was there, but if anyone else wants to chime in, I'd love to hear from you.
Yeah, Oscar, I can chime in. Morgan and I are participating in that training. And I think the first training was kind of focused on thinking about how to make DEI how to approach DEI work across different facets of an organization. So there was a table related to board development, fundraising, HR. So all the different ways that you need to approach DEI so that it's really like a comprehensive approach within your organization, not just piecemeal. And I think it was just a 2-hour training, right, Oscar? And then the follow-up next week. So I look forward to the follow-up because I think that'll be where we dig in more into like the actual plans for our own agencies, or I think that's what it'll be. But yeah, we'll bring that back to our team and then say what it means for our organization internally.
Awesome. Thank you so much. Yeah, those 2 hours felt like they flew by. So, but yeah, there was a great conversation. That was Nancy Bacon and Rue Ramos were our facilitators for this workshop. And so, as Caroline mentioned, we'll have our second part coming up, and we'll hopefully dig in a little deeper on some of these DEI plans. And so, one that's also coming up that we've been partnering up with TRED is Belonging in the Outdoors. And so this is a workshop series. So this is a 3-part series. Our first part was May 11th, and we explored on people of color and their experiences in the outdoors. And so we watched a film, Expedition Reclamation, and then we heard from 3 panelists about their experiences in the outdoors. There's a lot of great questions on, how do we make the doors more outdoors inclusive? And we got to hear a lot of great insight. And it was really, I guess, it was really exciting to see how after that first day, we had organizations posting on, their social medias on, action step 1, here's how we can make outdoors more inclusive. And so, we're also donating funds. Any donations that we receive through this film and workshop series will be donated to 9 different organizations that do outdoor recreation work here in the area. Our second part is actually this Thursday. So if y'all are available and in the Wenatchee Valley, I'd love to, making a little pitch now, love to invite you all to come out. It's going to be at the Wenatchee Valley Museum, where we'll be watching Ascend and Elevated, 2 films that talk about folks with disabilities and their people living with disabilities and their experience in the outdoors. And so we'll again have a few panelists talk about their experiences and how we can make the outdoors more accessible for them and what they've experienced. And so this is going to be a great workshop. Again, it's absolutely free, and we'll have beverages and food, and we'll have a good discussion as well. And then the last one is going to be June 29th. And again, at the Wenatchee Valley Museum from 6 to 8. And the last one, we're going to be watching This Land and Here We Stand. Again, 2 films. And we hope to make an action item list and have some stakeholders there to then, as a community, to come up with some action steps on how to make the outdoor more accessible, equitable, and how we can move forward. So very exciting, and it's really great to have these different partners there, be a part of this learning series, or about this film and workshop series, and be a part of the conversation. Again, this is part of the reconciliation work that we're trying to do, of bringing folks together to have these conversations. And lastly, we're our last offering for this year as of now is the Signature Allyship, which is going to be September 30th and October 1st. So this is going to be a 2-day workshop to help participants identify areas of privilege and what it means to adopt equity and justice as a lifestyle. And so there is more information to come on that, but we have that also in our books to to offer this year. And I think John is going to be participating. And then can you remind me who else? Is it Caroline? No.
Sarah. I think
Sarah. Awesome. So I'm super excited to have y'all attend, and hopefully y'all can give us some feedback on how that, your experience with that. So again, that's September 30th and October 1st. It's going to be a weekend. It's going to be in the morning. And so it'll be a 2-hour training as well, or a 3.5-hour training. So a little bit about our future opportunities and what we foresee in the near future. Again, we're a very young organization, and I'm very new to this position as well. And so some things I want to explore are to serve as a diversity, equity, inclusion council for local governments and regional organizations. So we've been getting asked a lot to be on these different work groups. And so some of the work groups that we're on is, for example, the Career Network. I forgot what the whole title is, but there's a Career Network cohort per se, some trail work that's being done with TREAD. We're also on, well, let's see, what else are we on? Sustainability NCW has asked us to join them. And so there's different partners that keep reaching out. And we hope to also serve as a diversity, equity, inclusion council for the city of Wenatchee and East Wenatchee and other local governments as well. So as we start to expand and get bigger, we hope to provide some of those services. It's a little hard. I am the only person on the team, so capacity is at its maximum. But again, we're trying to be a good partner for everyone, and have folks lean into us for some of that work. Another thing that we hope to do is provide community outreach at local and regional community events. So for example, this weekend we were at Pride, and so we were able to offer, to talk to folks about some of the work that we're doing, how we can be allies, how can we help? And again, just start those partnerships and discussions and build those relationships with communities to, again, work together and not be so siloed in this type of work. So we really try to do cross-sector work and just, how do we bring it all together? And one of our last things that, is in my books is to explore the Learning to People Better Together cohort. So this is our second cohort, and we hope to create a networking opportunity either via LinkedIn or have some sort of a way to communicate. So if questions are asked, folks can chime in, right? Again, we want to make this as collaborative as possible and not just be a one and done thing. We want to continue the education. We want to continue the meetups. We want to continue the conversation. And so, whether that's, we have like a bi-yearly, meeting, a quarterly meeting with these cohorts where, again, we continue these conversations and it's not just a one and done. And so these are some of the upcoming exciting opportunities that we have with the NCW Equity Alliance. And I think that's all I have for y'all. Thank you so much for listening. And if y'all have any questions, I'd be glad to answer anything. So thank y'all.
Thank you, Oscar. I put Oscar's contact information and in the chat. And then if you didn't already notice, the registration links for the June 8th session for Belonging in the Outdoors and the Signature Allyship.
Are there any questions for Oscar? I think the nice thing to emphasize, I see Senator Warnick's hand. I see Peter and Senator Warnick's hand up. I think Peter beat you, Senator Warnick. Go for it, Peter.
Oh, Oscar, I really appreciate this. And I'm just, imagining, you out there and, the great work you're doing. But, nationally, things like DEI are, as they're gaining traction, they're gaining resistance and, political headwinds. And I'm just wondering if you're experiencing much of that locally and what support, we might be able to provide for you in that area. I mean, these things like, privilege, dealing with history and topics like institutional or structural racism. I mean, these are hard conversations to have with anyone, and they can not just make people uncomfortable, but resistant, angry, etc. Is this coming up at all in your work?
Fortunately, it has not showed up yet. And I say yet because, I'm sure I will run into this at some point. as far, as of now, everything has been good, but I also think it's the approach that we're taking, right? We're taking this approach of working together and not trying to shame anyone, right? I think you mentioned that, right? Like it's always like, oh my gosh, I'm at fault, or this is, but we're not trying to go there. We also understand that folks are different. We like to see this as a journey. So we also, we also want folks to know, we understand that you're at different places of your journey. We're going to mess up. It's okay. We can get up, continue going. And so that's really the approach that we're trying to take when we have conversations with folks, right? We're not here to shame. We're not here to, you did this bad. No, like we're here to act as a resource, lean into us and like help us help you, or like, yeah, help us help you, like understand or, educate, whatever help you may need. That's exactly what we're trying to do. So we don't know all the answers either. So I think a lot of it has to do with, just conversations and relationship building. So to answer the question, I personally have not seen it yet. But I'm not sure, early on during this work, I'm sure that there was some pushback. But again, a lot of this work is, helping folks and being there side by side, walking this journey together, versus expecting you to do the work and here we figure it out for yourself. Here's the resources. No, we want to have that conversation. We want to have that dialogue, and so we hope to continue that. And hopefully that approach is going to continue working for us. So I'm very hopeful and very optimistic about this work. And I totally acknowledge that it is difficult work. It is difficult conversation sometimes. But I think, something that we're learning in the Dare to Lead leadership, right, is just, kind of taking off the armor, right, and coming into this arena and talking about these things, but again, in a way that is productive and trying to understand others. So, yeah.
Senator Warnick.
Thank you, John, and thank you, Oscar. Mine is more of a comment, and I'm going to try to introduce you to a senator I work with, and it's regarding your outdoor work. Senator Twina Nobles is from the Tacoma area. She had a bill, and I can't find it right now, but regarding women and girls of color, because she is a senator of color and having more of an opportunity for outdoors. So I will try to, I wrote down your email, Oscar. I'll try to get that information to you because it may have ended up just being a budget item in the legislature, but she talked quite a bit about it, how important it was to her as a young girl. So might have some information for you as you move forward on those outdoor opportunities. So.
Thank you. Yeah, I love, I'd love to have a conversation and explore that. So I really appreciate that.
You bet.
And Penny, I appreciate your comment in the chat as well. So thank you for emphasizing that. I know I'm going to turn it back to Mariah because I know we are a little bit time constrained and we could ask questions of Oscar for a while, but I want to make sure we leave room for our other presenters. So Mariah, if you'd like to do a quick introduction and turn it over.
Absolutely. We are also joined today by Dylan and Penny from Triple Point, North Central Washington. They're going to lead us in a quick activity to wrap up our board meeting. Just as a little background, Triple Point was one of the recipients of the Community-Based Equity Initiatives funding that was opened starting in August of last year. And Dylan came into the facilitator role while also maintaining their former role at Children's Home Society. And Dylan, you were doing that up until I think almost March, right? So March, Dylan was finally able to devote full time to Triple Point. And at first I was, I thought we just gave this grant. They're in the midst of losing one facilitator, hiring another. And I met with Dylan and Penny in May, and I was just blown away by all of the progress that's been made in such a short amount of time, and wanted to invite Dylan and Penny here today to just share some of the exciting work and the progress made. And so I will let you, Dylan and Penny, take it over from here.
Right. Thank you so much for the opportunity to be here today and speak. I'm going to share my screen My plan is to tell you just a little tiny bit about Triple Point and then pull one of the trainings that I give in our Creating Safe Spaces training, which is a 90-minute community training about supporting LGBTQ+ youth and adults. This is an interactive exercise, so please have a piece of paper, a pen, and a pencil. Or a good imagination, if that works better for you. I'm going to share my screen. All right. So Mariah, thank you for the introduction. I love Triple Point. A lot of people don't know why Triple Point is called Triple Point. It's because we do 3 things. Well, we actually do a million things, but we have 3 that we talk about. We do weekly support groups for LGBTQ+ youth ages 12 through 18. I have a Zoom support group on Tuesdays and an in-person support group on Fridays at the YMCA. We do Creating Safe Spaces trainings. This is for professionals serving LGBTQ+ youth and community members. And I'm also available for phone and email support to parents and caregivers of LGBTQ+ youth, regardless of their enrollment status or their age for our program. So they don't have to be a Triple Point kid for parents to still reach out and get some assistance. And of course, we run through Children's Home Society. Yes, so support groups, we have 2 a week. Parental permission is not required for 13 and up, which is great for the kids that maybe don't have the most supportive families. The Creating Safe Spaces training is 90 minutes. It covers LGBTQ+ terminology, intersectionality, data analysis from the Trevor Project, an interactive coming out exercise, which we're going to be doing in just a moment, gender affirming language, and suggestions for personal and organizational allyship. Reach out to Penny Wheatcroft. She is my supervisor and the best. And she is scheduling all of these community trainings. They are free. We are chomping at the bit to get this information out there. We are so grateful for the grant that we have that enables us to do so. And lastly, parent caregiver support. There's my email, there's my phone number. I'm very available to help assist parents. Children's Home Society's goal is keeping families and children together, helping them thrive. Primary way we can do that is by supporting them. So this is our interactive coming out activity. I am going to ask that everybody please draw a 5-pointed star with pen. So non-erasable star, please. And look at the colors of the stars on the screen to determine which color star you're going to be for the next 5 minutes. February birthdays, you are white stars. Purple is March, April, May, and January. Blue is June, July, and August. And green is September, October, November, December. On each of your points, you are going to label them as town, housing, friends, office, family. The idea here is that this star is your supports. Imagine yourself as an LGBTQ+ person. Maybe you're a youth, maybe you're an adult. For the purpose of this exercise, that doesn't matter. The point of this exercise is to show you the peril that comes with coming out in your community and to your people. Can I get a thumbs up? Are people ready? Have I given you enough time to find your color and draw your stars? Awesome. Thank you so much. So I want you to think about your best friend in the whole wide world, the person that you are closest with, the person that you trust the most outside of maybe your romantic partner. If you have a blue star, your friend is accepting. You say, you know, I'm queer. It's been hard for me to come out to you and I'm finally doing it. I really hope you accept me. Your friend says, yeah, I've known you forever. Of course you're gay. It's fine. Like you're good. But not everybody is as lucky as the blue star has been in terms of coming out to their friend. If you have a white star, you are met with anger and disgust. Your friend severs connections with you, no longer wants to be associated with you, and you've completely lost that support. So cross this corner off your star with pen. It cannot be erased. This damage cannot be undone. If you have a purple star or a green star, your friend is very hesitant. They are annoyed that you waited so long to come out to them. They're kind of uncomfortable with it. They don't know a lot about the LGBTQ plus community. But after having some difficult conversations, you feel like this friend is coming around. You don't feel like all hope is lost. You just feel like maybe they need some time. So take your pencil, cross out that corner of your star with a pencil. You could erase it. Your friend could come back around, but for right now, that support is not there. Next, you decide, all right, I already did it. I already came out to my best friend. Up next, I'm going to come out to my family. So if you have a blue star, your family accepts you with open arms. We love you no matter what. Love is love. You've always been the person that you are, and we're always going to love you. All of the responses that you could hope for from your family. If you have a white star, your family completely refuses to accept your identity. This is not the way that we raised you. This is disgusting and perverted. Cross that corner off with a pen. That corner is not coming back. Your family's not changing their mind. Same thing if you're a purple star. Your family refuses to accept your identity. Cross it out with pen. If you have a green star, your family probably looks a little bit like mine, and it takes a little bit of time to understand and to accept. There's a lot of hesitancy. Some of that support has eroded. Some of that support has changed, and maybe you're not actually sure if it's there or not, but it's not gone. So that's when you use your pencil. Cross that out with pencil for the time being. It could come back, but right now it's not there. So friends are done, family's done. We're always told to bring our whole selves to work. So you just decide to give it a go. And you tell your coworkers and you tell your boss. And if you're a blue star, you get the best support. They're completely accepting. That is okay. Welcome. This is a safe, affirming environment. Everyone's uniqueness makes them special, all of the good things. If you are a white star or a purple star, you feel absolute hostility from your coworkers and clients. Connections are ruptured and your ability to succeed has been undermined. You're doing the same quality of work that you always have been and are getting graded much more harshly for it. You've lost any sliver of grace or benefit of the doubt, and people don't want to work with you anymore because of something outside of your control. So if you are purple or white star, cross this corner off with pen. That connection's not coming back. You're going to need to find a new job. If you're a green star, your colleagues find out that you're LGBTQ+, and they start treating you differently. They start speaking to you less. And while you can still do your job effectively, it's colder. It will take you a while to feel comfortable at work again. So use your pencil, cross off that corner of your star. There's hope, but it's not there right now. After you've come out at work, you decide to tackle your housing. So you're telling your roommates and your landlord. And as you know, roommates have big mouths. They're probably going to tell the neighbors. So if you have a green star, your roommates are mostly accepting, but you can't bring your SO home. You cannot bring your boyfriend or your girlfriend. They would be very uncomfortable. They're okay with your lifestyle, but not in their space. So you can't have your partner over. Cross that out with pencil, because what was once, full support is very partial and very tenuous now. So it's not ready for the pen, but it is ready for the pencil. Same thing with the purple stars. Your roommates are mostly accepting, but you can't bring home your partner. If you have a white star, your community reacts with hatred. Your neighbors find out and your house is defaced. Your landlord is unresponsive. You move out due to safety concerns. Hopefully you can afford something else with that same rent. cross out that corner of your star with pen. It's not erasable. That's not coming back. If you're a green star, you get a relief for a hot minute. Your identity is accepted by your community and you are warmly embraced by your neighbors. And you feel really, really lucky. Lastly, think of your town. So for me, this is where I go on Friday nights. I go out and do karaoke. Think about where in your town you love to go. Where do you find yourself often? Where are you a regular? Where do you walk in and you own the place? If you're a blue star, you walk in where you own the place, where you do everything you always do, and you and your date are followed and you're verbally taunted. They call you slurs, they make disgusting comments, and you're not hurt, but you feel very unsafe. Cross the star off with pencil. You know, you're okay, but the support that you thought you had isn't really there. It's tenuous. If you have a green star, you and your date have a lovely time. You feel affirmed by your community. It's great. If you have a purple star, you and your date are not only verbally attacked like the blue star, you are also physically attacked. Cross this corner off your star with pen because you have now been hurt for your identity or your sexuality, and there's nothing you can do about it. Lastly, if you are a white star, you've gotten the really short end of the stick here. You also leave the restaurant with your date and are verbally and physically attacked. For the white stars, this is the last straw, and they become one of the 14% of LGBTQ+ youth between the ages of 13 and 24 who attempted suicide last year. Cross out your whole star with pen. So thank you so much for allowing me to do this heartbreaker of an exercise. The purpose of this is to show how much risk there is, and that for those of us that have gotten off fairly lucky, maybe our stars have a lot of pencil on them, but no pen, to understand the fear that especially LGBTQ+ youth have starting this process is tremendous. And the most that we can do as allies and community advocates and community partners is to do everything that we can to be safe, affirming spaces for these youth. We can learn how to be the best allies that we can be, and we can ensure that at least one out of those 5 points stays strong, and that would be their community. So thank you so much for the opportunity to speak with you today. Thank you, Mariah.
Thank you, Dylan. That activity, I was a white star, so my sad little star, and I really appreciate you leading us in that exercise.
Thank you, and I'm sorry.
And let me ask, is there any, thank you, Dylan, for going through the exercise. I appreciate that. It's good to really understand and feel how other community members are interacting and engaging with our community and you know, what is really occurring out there. So, but what I wanted to ask, any board members have any questions about the program as a whole, or anything that, you know, just any comments on going through the exercise?
Yeah, please, anything. Ask Penny. I cannot shut up about Triple Point. We do so much cool stuff. The grant enables us to do so much cool stuff and serve our youth so well. So thank you.
Go ahead, Caroline. I see you on mute.
Yeah, Dylan, I just want to thank you because I think that was like a very sad but effective way to really feel the exclusion that sometimes you read about or you're told about, but like you don't, you know, like that just brings it home, especially when you're narrating what each of those points are. So yeah.
Thank you very much. Please feel free to steal it. I stole it from another trans person giving a training. It is a really powerful teaching tool.
Peter, Teresa, Peter, you keep getting first in this hand raising thing.
I found it a really interesting exercise. I mean, obviously, depending on where you are and what phase of life you're in, it's it's very different. But I can imagine trying to come out after a 45-year marriage would be different than when you're a teen. But nevertheless, I'm just projecting the challenges that all people have or could have, and that friends have had. So it was helpful for me to kind of go broad with that and try to imagine all those scenarios. So thank you.
Thank you.
Teresa.
Hi there, Dylan and Penny. I'm with Public Health over in Grant County, but I did take down your information just to share with you, talk about even more sad information. All of our counties are re-engaging in their child death review process. That's where we take a committee through a process of a child's death. And we all know that in North Central Washington, our suicide deaths are higher than they were when we previously did this work. So I got your information, but that if you get an email from one of our groups, because we need folks to come to these reviews from their perspective, so that what we do at the end of these reviews is make recommendations to our communities on change, gaps in the systems. It's a whole process we go through. And while none of them are up and running yet, we're getting closer to being able to do that. And I think Sean Douglas and Okanagan, like us, they're going to go back a couple of years so that we can capture that and be able to share that information with our community.
Yes, please. Thank you for thinking of Triple Point. The way that I approach community members whose beliefs are about 180 degrees from mine in terms of serving queer youth is we can always start on the common ground of we want our kids alive and graduating high school. And we can fight over absolutely everything else while they are still sitting in school and breathing. So I'm looking forward to that connection, Teresa. Thank you.
Well, again, Dylan, Penny, sorry you didn't get to say as much, but Dylan kind of took the show. And Oscar, if you're still on, thank you guys so much for taking time to come and present and share the work you guys are doing in your region. And we just appreciate you being here as part of the board meeting. So thank you so much for that. And Molly, I think I'm going to turn it over to you to close us out.
All right, thank you. We do have just a few extra minutes, and I'll try to talk through the lump in my throat. That was so compelling. Okay, this grandma had a hard time. But I did want to do a round table of board members of who are remaining here to see if you had anything you wanted to update us on. So I'm going to start with Ken Sterner, since he already just laid one on us earlier.
Well, that was about it. I don't really have anything to add to that, but thank you very much. Things are getting busy here, and now we're getting back to our pre-pandemic process and everything else, and that adds just a little bit more onto my plate here. And I've been doing this now for about 7 or 8 years, since the very beginning, since way about the same time Peter, I think you got involved as well. I remember some of those brief meetings when we were first trying to put all this together. So I think at this point it's hard to always pick a good time when to step off and when to step on, and at this point I think this is probably a good time for me to step off and thank everybody and wish everybody the best of luck. It's been a pleasure working with everybody, and thank you. I look forward to working with all of you at some point, some way in the future.
We will be in touch. So yes. Manuel, you came in a little late. Sorry about that, but did he jump off already? Maybe he did. Okay, fine.
No updates for me. Thanks. Sorry.
Okay. Ray?
Yeah, I just want to do a shout out we did a big heart screening event for all the youth in basically Chelan, and I asked some Chelan, Douglas County and Okanagan County school districts too. But we, with the Nick of Time Foundation, we screened 216 kids on Friday for electrical and functional defects, and we found 2. And so I don't know if you guys know, 2 weeks ago on Friday was a state B track tournament in Yakima, Washington. And at the end of a race, a teenager finished the race and collapsed in cardiac arrest at the end of the race. And that, to my understanding, that child was shocked twice and resuscitated and stabilized. But that girl's was running obviously all year, and was trying to PR and do her best. And we don't know. People look normal when they have some cardiac defects. There's like 6 hereditary reasons for long QT syndrome, and I could keep going on and on. But heart screening is not part of your physical with your PCP. And this is where we had 4 cardiologists from Children's University of Washington who came over and helped screen those kids. So I'm pretty happy that we got a turnout, and hopefully we can get them in 2 or 3 years because they're pretty booked out. First one in our region, by the way. So I'm pretty happy.
Yeah. You guys are tugging at my heartstrings today. Oh. Senator Warnick, do you have anything?
Whoops, couldn't get it off mute. Well, I don't have any as exciting news as Ken, or as heartstring as Ray, but I think the good work that they're doing to screen those kids is fantastic. Just trying to catch up on what the organization is doing. I didn't even know the name had been changed. So I have not been able to connect with you all for quite some time just because of the legislative duties, but appreciate the programs today, and I hope I can continue to work with you all. So don't have anything extra to add at this point.
All right, we owe you a cup too, so that you can catch up.
Oh,
yeah.
Okay. All right.
Okay.
Thank
Dr.
you.
Tuggy. Yeah, Dr. Tuggy.
I think he stepped off.
Okay.
He was in the chat.
Oh, okay. I missed that one. Maddie.
Maddie here with AmeriGroup. Can you hear me all right?
Yes.
Oh, great. No, I echo, thank you for, this is a great meeting. I thought that the retreat was a really great opportunity to connect with a number of folks in person. And I just always appreciate the balance of information and then also that civic muscle. It looks like we're really filling out our promises in terms of the mission, vision, and values. And as a managed care organization, you know, that's a tough role, or not tough role. It's that's not a good way to put it, but it's not the most liked role. But we're dedicated to the community and our role. So I do look forward to leaning into those tough conversations and being a good partner. I can't speak for all the managed care organizations, but I do see that there's an opportunity. So I look forward to that. I'm dedicated, and yeah, just thankful for being here.
Thank you. Teresa.
Hi there. A couple of things from public health. We just finished up our concurrence process for foundational public health funding through the state legislature. They did meet the request, and those appropriations are made through a committee that I am fortunate enough to get to sit on and discuss where those dollars will go. So your local public health departments are busy planning because they will be seeing additional staff and support systems coming their way after June for the next biennium. I know I can speak for Grant County, our injury prevention programs coming back, Safe Kids Grant County. It's been kind of on hiatus, and we've kind of kept it a little bit alive with our life jacket loaner boards, but getting that in full swing. That's why it's going to align well with our child death review process as well. Additional investments being made into data and epidemiology support for our communities, as well as some translation services. So I'm so excited. The number of programs that we were able to fund is pretty impressive, and a lot of innovative work coming the way. So while North Central Washington didn't get all of the activities funded we were hoping for, we did come out nicely as we transition out of COVID. Most of our COVID funding will end at the end of December. So we're all working hard to kind of transition those staff over to some of these other program areas. And the staff are excited. They're eager to get back and involved in the community. So yeah, anyhow, thanks.
Thank you. Okay, Nancy.
Gotta get myself off the mute here. So two things. One, Shalane Douglas Chai is very close to getting a director. So we have one more step, and then I'll be able to tell you who the new director will be. So we're really excited about that because we can get a whole lot more done if we have someone in charge and getting us moving forward. As far as the other job that I'm doing currently at Wenatchee Valley College as the interim area health education director, we moved slow in our first year because we were doing lots of planning, but over the summer, we're planning several events throughout all of Central Washington. We did hold what's called a Scrubs Camp at Wenatchee Valley College, where we had 31 high school kids who came for a full day of different hands-on health career information sessions. They got to dissect a pig's heart and all kinds of fun things for the day. So that was a really fun activity, and kids walking away going, yes, I want to do this. So that will be some of the continuation work and also getting into high schools. And we are also in the process of hiring for more positions for the Area Health Education Center. And so we are currently looking for someone who would be interested in an outreach and recruitment position, and that person will go into high schools actually and work with kids in high schools.
Linda.
Hello. Well, it's always one of our favorite times of the year because graduations are upon us. Moses Lake had theirs last weekend in some of our other schools, and we're wrapping up many this weekend. With graduation and the end of school also still does come some summer programs that we have out and about in some of our districts. From summer school, there was some summer meal programs, so we still provide some summer meals to families. We're out and about in our migrant camps supporting our students, our families, and our workers that are under 21. The Youth Development Department, I see Molly's on here at the Confederated Tribes of the Colville Reservation. They have a ton of opportunities for kids, from learning experiences to apprenticeships to building tiny houses. So even though we have a summer break, school is still in session and available for many. So
I keep telling my senior granddaughter that she still has a week of school and she better make it every day. No senior skip days. All right, Peter, you're always at the bottom of my list. So.
Oh, I forgot one last thing.
Oh, okay.
Can I add it in? I'm sorry, Molly. For those that work with our school district partners, just a little bit of an update around superintendents in our region. Patera School District has a new superintendent already there, but that's Scotty Wiltz. I can't pronounce it very well. Grand Coulee Dam School District will have a gentleman by the name of Rod Brodnack starting September 1st. And Manson will be receiving a new superintendent, but they are just
Glitched.
I
The
think she
suspense is killing me.
Yeah.
Linda, you told us about Manson, but then you glitched, so we didn't hear a thing after that.
Oh, shoot. So Manson, they will be screening, I believe, the end of this week. And so we won't know on Manson School District till either next week or the following week.
All right, thank you. Peter.
Just trying to stay in touch with this work, with the work of the Okanagan Chai and Alana and Michelle. It all feels, very, very aligned, and also with, Jesus Hernandez and the Family Health Center's board. All these things seem like they're dovetailing nicely. And I'm just trying to make sure that I understand it all. So thanks.
Got it. Thank you. Now, any of our guests have anything, or staff, to add? We have just a couple of minutes.
I just wanted to give out a quick shout out to a couple of our partners. I was with my family this weekend up in Lake Chelan, and surprise, surprise, saw Ray representing his organizations. But I went to a concert, and it was a fundraiser for only 7 seconds, which if you've been to our last partner convening, is about dealing with loneliness in our region. And it was a great fundraiser, great music, great wine. I think that's how all of our partner convening should maybe be, is at the farm in Chelan. But it was a great time, and great to see so many of our partners hard at work and getting the word out. So thanks.
Thank you. All right. Well, nothing else, then I will just say that August 7th is our next.
Senator
board.
Warnick, you have something?
Yes, do it.
I have a question. I want to know where Peter Morgan's background came from. That is the most gorgeous piece of woodwork I have ever seen. So I just want to know where he got that, or if somebody made it for him. Oh,
You're on mute, Peter, so you don't really want to share.
Oh yeah, a local woodworker made it for
yeah,
me.
It is beautiful.
It is beautiful.
It's a scene from what I look out on from my house. It's a scene of the mountains that's actually familiar.
Wow. So sorry for that interruption.
No, that's good. I love that. Yes.
Thank you.
Yep. And again, the next board meeting, August 7th. So everyone have a great mid-year. See what all we have to get done before next board meeting. And I adjourn meeting.
Thank you.
Thank you all.